Evening, ladies and gentlemen. It is wonderful to have you all as part of the National Hematology MBBS quiz. We've had an overwhelming response in the last, so to speak, 9 days after the uh, brochure was sent out. We've had a total of 3,253 registrations with almost 2,600 contestants. We are still grappling with the process of how to process the entire quiz of getting the participants in, and we hear that only about 600 people were able to log in, and the another 2,500 600 people are yet to log in. So we have made a little bit of change in the slide, in the pattern, and the quiz will start in half an hour's time. We will go ahead with the symposium presentation on sickle cell, and we'll hope that more people will be able to get in. So with that, a small introduction on today's date. The importance of November 7th happens to be the National Cancer Awareness Day. This is different from the usual World Cancer Day, which is on February 4th. Uh, this was mostly this entire process was a serendipitous discovery, though we were thinking about having a hematology quiz for the MBBS students after the initial rollout we've had in 2011 in PJ when Pankaj was the organizing secretary for ISHBT. This came out from a talk which we were to do on sickle cell anemia, and that evolved to such a big program, and with so many people expecting to come in and interested in coming in. So this is the start of it. This is the first time we are doing a virtual quiz with all its limitations, except for KBC, where there is a real time and only everybody else is watching. This even the participants are virtual. So that's a challenge we've had. We've had a wonderful support from the the IT team from Gujarat, the Mice Ideas, and importantly, we have a wonderful young team of quiz squads. They are the Turks, young Turks of hematology for the future, and we have from PGI. Just give your say hi, Dr. Arun from the army background there. Dr. Ketan Modak from CMC Ludhiana, he's from Nagpur. Dr. Urmi Mala from Kolkata, she is from PGI, she's doing a DM second year. So most of them are in DM second year students. We have Dr. Pujita Bairedi from Andhra, she's doing DM hematology from CMC Ludhiana, and Dr. Preetham from PGI Chandigarh. So that's the squad, and you will get to see most of them more of them in the coming rounds, and they'll be doing the first 5 rounds. Next slide, please, Mr. Somnath. So the format of the quiz is fastest finger first, and we'll have a 50 MCQ online screening test, and the challenges of submitting the answers also will be related to the IT, but I guess it will be proportionately divided to everybody. So nobody gets an extra advantage of submitting, even if you have finished it first. I'm sure about 2,600 people who are taking the quiz. Many of them will have multiple scores. So the first parameter for priority would be to look at the scores. Then we will be looking at the time to submission. So we will have a time to submission up to milliseconds. We can do that on a spreadsheet, and we'll be looking that. So both these parameters will be taken into consideration for selecting the top 6 finalists. The topics, as we discussed earlier, will be related to hemolytic anemias, but not strictly only hemolytic anemia and its subsidiaries. We are still grappling. We have hemolytic anemia related to another disease. Process of quizzes related to that. Questions related to that. And your 50 MCQ, we made it as entertaining as possible, and we would want it to be an infotainment. That's the word we have used. Pankaj will be talking more about a few more additional terms which he will want to share with you when he is going to talk. So basically, we want to make sure that information is fun, and learning should not be a drab, fearful, cumbersome event, but fun, the way you enjoy treating patients. You should enjoy making the right diagnosis, and give the best you can give it to them. Next slide, please. So we have two mentors from PGI, Dr. Pankaj and Dr. Amita. I will request Dr. Amita to say a few words as we start the first edition of National MBBS Hematology Quiz. Over to you, Dr. Amita. Dr. Amita is the consultant and head of pediatrics at PGI Chandigarh in the Advanced Pediatrics Center. She has mentored many students in her tenure, and as I understand, she is a graduate of CMC Ludhiana as well. And that makes it the relationship even stronger. Over to you, Dr. Amita. You need to unmute yourself, please.
Yep, thanks. Yeah. We're still not 100% acquainted, used to all the virtual world we're learning. So thanks a lot, Joseph, for taking this initiative and organizing this quiz, which I'm sure is going to be wonderful for all the students. And, it's the first of its kind, and I'm sure we'll end up having more and more of these, because the most important thing is it brings all of us together from different parts of the country. So now if you look at quizzing, so the simplest definition of a quiz is entertainment based on knowledge, right? So a bit of trivia that quizzing started during World War II. The BBC radio started it, and it was basically to test the knowledge of volunteers during that time. And after that, it just became entertainment on radio channels, with radios giving out little prizes for guessing the correct answers. And of course, then it went out to the Bonvita quiz and just alluded to the famous KBC. So now, why are quizzes important? So it's simple. Quizzing is a way of learning. Learning by rote is dull to say the least. And I think all of us doctors and all you youngsters who've just gone through the grilling exams know that that's, it's quite a pain to say the least. So quizzes are educational fun. They help you concentrate as you have to keep, your total mind focused at that point of time. So they're also a form of retrieval of knowledge of what we have read. And whenever there's retrieval, it improves retention. They're not stressful. They're not like an exam. They make one enthusiastic, because whenever you give a correct answer, there's a sudden adrenaline rush, which makes you feel happy and, improves enthusiasm. So there are interactive sessions from which we gain a lot of knowledge, and it helps us to acquire critical thinking and also encourage innovative learning, which is out of syllabus learning. That's very important. We're so used to our books and, just doing what the syllabus says that we forget the world outside. And there's a lot of, it's very important to remember out of syllabus learning. It also encourages teamwork, which improves our skills at working with each other. So when the quiz starts, for all the enthusiastic youngsters out there, we are so happy that, so many people have registered. Shoot for the moon. Even if you miss the moon, you'll definitely land among the stars. So all the best, and back to you, Joseph, for carrying on the good work. Thanks.
Thank you, Dr. Amita. And now we have Dr. Pankaj. Pankaj and I share a much friendly relationship over the last many years. After I came back from CMC Vellore, the last 12, 13 years, we have been together discussing many things over. And during his tenure as the organizing secretary in PI Chandigarh, we had the opportunity to do a quiz in November. That was 11/11/11 at 11 a.m. on 11th of November in 2011. So that was interesting. And over to you, Dr. Pankaj. And he has been mentoring many students, many DM students during his tenure only. The DM program started in PGI Chandigarh along with Dr. Subhash Verma. And he has a lot of experience in encouraging students to take up this specialty. Over to you, Dr. Pankaj.
Yeah, thanks, Joseph, and greetings and welcome all. Hematology as a specialty is very unique. Generally, any medical specialty has two branches, medicine, for example, gastroenterology or gastomedicine and gastrosurgery, neurology and neurosurgery, nephrology and urology, and so on. So here you have hematology also, has so much advanced that it has two branches, clinical hematology and hematopathology. Hematology as a specialty is one of the fastest growing branch, and you can imagine its growth in this sense that even COVID-19 is considered as a hematological disorder, and hematologists all over the world are playing a very important role in its management. I would actually leave on to you to find out the reasons why hematologists are involved in the management of COVID-19. So hematology is, all there, whether it is discovery of new monoclonal antibodies or CAR T cell therapy, or a new syndrome like Vexus syndrome, which is discovered as a disease entity just a couple of weeks ago. PGI and CMC Ludhiana organized hematology quiz for postgraduates on the occasion of National Hematology Conference, Hematocon, as Dr. Joseph said, and it was organized on a unique date, 11/11/2011 at 11 a.m. And it was an instant hit, and students who participated still remember it. Since that time onwards, we were actually thinking of organizing hematology quiz for MBBS students also, and I'm glad that the dream is coming true today. Of course, the dreams never end, and the future dream is to bring hematology quiz for class 9 and class 12 students also. I feel privileged and honored to be associated with this quiz, and hopefully we will come up with the version 2 of this quiz soon. Thank you very much, and welcome to the word of hemotainment. So we are talking of entertainment, so I'm talking of hemotainment, which means hematology as an entertaining branch. Thank you very much, and over to Joseph.
Thank you, Dr. Pankaj. So from infotainment to hemotainment, and this cannot be possible without a team working behind it and funding report requirement. So Novartis had come up with this support for us, and I must thank the virtual partners, virtual platform hosts. Mr. Rajesh and Somnath is here with us from Mice Ideas. So you will see the mettle of them, how they have collaborated with us in creating the interface to interact. And we have to go a long way ahead. There will be a lot of errors, complaints, not able to log in, questions were not clear, 100 things may come in, but this all evolved in 3 weeks now. So we will take all your suggestions well, and we will reform ourselves in the coming days, and we are hoping that we can do these editions every month or even once in 2 months on various topics. We'll talk more about the future plans later, because there is so Mr. Somnath, can you just tell us how many people are registered right now? 780. So that is less than 1/3 of the total aspirants, and I'm sure that we may have to leave many of them discouraged, or they will be disappointed in the end. But so what we thought is that we will have we will delay the entire process by another 20 minutes more, and we will have the quiz after 20 to 30 minutes. So we'll go with the initial presentation on the sickle cell disease. Next slide, please. Okay, so what we'll do is giving you a glimpse of sickle cell disease from a different perspective, and based on a lot more basic science advances which have come through. We are all aware of coronavirus. It is not the virus which actually kills us. It is the inflammatory process, something which is supposed to be doing good to our body goes haywire or go overboard, and that is what kills us, kills the human beings with the coronavirus. Similarly, sickle cell disease also is a process of multicellular adhesion and inflammation. That's what we'll touch upon a bit on that, to give you a bird's eye view on what are the possible interventions we have, and Dr. Ketan will be taking it forward from my talk. Next slide, please. So that's a disclaimer which is mandatory for any sponsored program, and none of these are, all these, what I'm saying is responsible for my views and based on the data, and nothing from the company. Next slide. So that's the spread of sickle cell disease across the world. And if you see, the tropical countries are affected the most. And if you look at the Indian spread of disease, you will see that it is a band which is in the central part of India, and that spreads between Maharashtra, Madhya Pradesh, Chhattisgarh belt, and Gujarat and Orissa belt, and few in Gujarat. So that's the belt which is affected by sickle cell the maximum. And that is where we need to act upon for more effective treatments to avoid problems with the patients. Next slide, please. So if you look at the pathophysiology, there is a bit of adjustments on the size of the pictures there. Nevertheless, it is basically uh, because of the sickling, the cells get blocked in the blood vessels. And initially we thought that it is the sickling which is happening at the blood vessel level which is causing the blockage. Now we know that it is beyond that, more the pathophysiology is beyond that as well. Next slide, please. So this a bit of formatting error and the background. I think when we copy pasted, we should have copy pasted with the format in place. So that's lessons we will learn as we move on, and we have to shift the slides a bit up and down here. So by and large, the sickling happens because of this abnormal hemoglobin, which has got mutated at position 26, will cause excessive polymerization of the cells. And that is the reason for deoxygenation subsequently, which has happened. And if you see, I mean, it is not very evident in this picture because the background is a bit changed. Deformation of the cell structures which happen because of the polymerization and the interaction of the cells with the endothelium and RBCs and the platelets. And that is the reason of the clotting mechanism or the blockage mechanism which happens and leading to hypoxia, and hypoxia further aggravating the polymerization of the hemoglobin chains, causing further damage. Next slide, please. Our normal red cells are designed to change its shape and make it pliable and move through the red cells. But because of this entire process of inflammatory process, which affects the endothelial activation and subsequently inflammation, which is the problem which is happening here. So it goes through the process of endothelial activation, enhanced adhesion of these cells onto the endothelium. Neutrophils get activated, it gets polymerized, the red cells further polymerize and leads to a chronic hemolysis as well. So for remembering, hemolysis because of adhesion, inflammation, and activation because of the polymerization, excess polymerization. Next slide. So along with these activation, understand a whole lot of cytokine release happens. So all of us know that certain drugs are used in coronavirus infection, which will attack a certain interleukin. And that is one of the inflammatory processes which happen. The cytokines get released. But this entire process is activated based upon many adhesion molecules which have causing the cell-to-cell interaction or cell-to-endothelium interaction. So a red cell interaction with neutrophils is communicated through a particular phenomenon. The red cell with neutrophils and platelets in a different manner, then the red cells with endothelium is in a different manner. All of this is based upon the molecules which you say this. You can get confused with this, but there are about 4 or 5 major molecules which causes this interaction. Next slide. Next slide, please. So if you look at that cartoon there, you will see that the yellow bars are called selectins. Now these selectins are adhesion molecules which allow the red cell to come and attach onto the endothelium. And it further causes cross-linking between red cells, white cells, and other platelets. So this entire multi-cell adhesion and aggregation will now cause occlusion of the red cell. So it is not only the red cell, it is the neutrophils and the lymphocytes interacting with the endothelium. Next slide, please. So going deeply into this, I won't go beyond this. I mean, bore you with more information which is written there, and that is something which you don't have to tax your brain to memorize. But understand all these interactive mechanisms which exist between these cells has the potential for a targeted therapy. which means that we can actually design some molecules which can interact or inhibit these interactive processes to reduce the sickling process. Next slide. So that is a cartoon which shows what happens inside the blood vessel. There are some animated pictures at the side. Can you go through the other slides, please, Somnath? So this hemolytic anemia and vasoocclusion can further cause tissue hypoxia. And as we understood from the oxygen dissociation curve, which we have all learned in our physiology, it moves to the left based on pH, based on temperature, based on oxygen saturation. It moves to the left, it causes more vasoocclusion. More vasoocclusion causes more hypoxia. So so that is when somebody has a joint pain and an occlusive crisis, it begets another occlusive crisis, and unless you break the chain, it'll be difficult. So it's like a self-fulfilling prophecy of I'm going to do badly. It is done badly, so the bad will get more worse, and you go down till you break the chain. Next slide, please. So in summary, the pathophysiology goes beyond the red cells. So that's the point I'm trying to make to all of you. It is not just the red cells. It is the interaction and interplay which will happen. So if you look at the community, if a person goes bad, it is not only his mistake, it is a whole lot of environmental issues which will play there, how the environment has behaved with him, how he has behaved, what are the other parameters which came in there. So it is an interplay of pathophysiology of a multi-system, multicellular, multi-inflammatory process which is happening there. So if you look at it, to revise endothelial activation, we have excessive adhesion, then the neutrophils get activated, it causes polymerization, and subsequently the cells die. Next slide, please. So there are veno-occlusive disease, so that veno-occlusive crisis. So when you have a blockage in the red cell or the blood vessel, now if you look at our backgrounds, you will see that we are all sitting in a red blood vessel, and it is, imagine the vascular space the way we are sitting, the background or the virtual background which we have got. So we thought it is appropriate for all of us to have the red background because it is hematology. So imagine these blood cells which are biconcave on the side. If you see on this side rather, okay, I'm not able to see, okay, this side, this biconcave cells. Imagine these biconcave cells now becoming sickled or banana shaped. And those cells then begets more sickling by the process we just mentioned. And there is a hypoxia at the distal point. Next slide, please. Okay, so if you look back in the history, veno-occlusive disease is the #1 cause for hospitalization of sickle cell disease patients. And this leads to, as I mentioned, hypoxia, ischemia, damage, acidosis, further aggravating the problems. The #1 joint, which is the site in the body which is affected is the joints. A lot of analogies with the hemophilia patients also get affected by joint pains. When there is deformity there, it is sheer pain here. That is because of the ischemia which is happening to the joints. And it can happen in any other tissues as well. It can happen in the lung, it can happen in the liver, or it can happen in the brain causing infarct. It can happen in the liver causing hepatitis. It can happen in the kidney causing renal failure. It can happen tissue hypoxia, salmonella infection. All of this can be because of sickle cell disease. As this talk is dedicated and the quiz is dedicated to hemolytic anemia and sickle cell disease, you will see a lot of questions related to sickle cell. Hopefully the awareness goes up. The patients affected with sickle cell in the middle part of the country will be benefited from each of you who are listening to this lecture, and MBBS students are more sensitized with sickle cell and hemolytic anemias. Next slide, please. So that is just a cartoon to show how the entire thing happens. So anything starts with a prodromal phase, the initiation, a log phase which happens, then it plateaus out and it comes down. Our excitement, enthusiasm of hemophilia or hematology quizzes also will be like this. There is a hype curve, it is called. is, there is a name for that. It is Diamond Gardner curve. It is called Gardner's curve. So there is a initiation phase, there is a hype phase, then it plateaus down and it comes down. Hematology is in the log phase now, the initiation phase. So as Dr. Pankaj said, if anybody wants to be excited about taking a specialty in medical science, hematology is one good place where you will get excitement from basic science, molecular medicine, and interventional, and doing bone marrow transplantation. We will discuss some of these things in the subsequent slides, subsequent sessions on hematology and as its basics. So all of these situations will cause an intermediate pain, recurrent crisis with no intermediate pain, or a chronic pain. So essentially the point is, you have one veno-occlusive disease that predisposes the patient to more veno-occlusive disease and leading to chronic pain. Next slide, please. Next slide. So veno-occlusive disease, to give you a flavor of or a bird's eye view on veno-occlusive disease, it is only the tip of the iceberg, and many other situations happen below that which we need to address with new agents coming in. I'm sure most of the medical students who are listening to this lecture would be inspired to take up research and clinical work. In fact, we need people who can do research and clinical work. There are very few people in the country to do that avidly, and we can find solutions to these problems. Next slide, please. So as we mentioned, if you have to summarize everything and, what is your take home after this 20 minutes lecture? You have the red cell, which is polymerized for some reason, ischemia or temperature or lactic acidosis, causes inflammation and cell activation, causes adhesion, inflamed, adheres, veno-occlusive, end organ damage. Next slide, please. So that is again another cartoon to show a three-dimensional view of your neutrophils and the red cells. So neutrophils have these pseudopodia coming out, and these have these selectins and adherents and the cadherents interacting within the endothelium and cell to cell. So these pokey stuff, I mean, if you look at coronavirus, it has got a spike protein there. It's called a lot of spikes coming out. So that is how these guys interact at the molecular level. This is not coronavirus. Coronavirus also has a similar look of it when you look at it. The next slide. So these are various things which will come in. So this is one important slide I must tell you. So this is an analysis done on the lifespan of patients who have had a veno-occlusive disease and who have not had a veno-occlusive disease. So if you've had a veno-occlusive crisis, not disease, sorry, veno-occlusive disease, we talk about liver, but veno-occlusive crisis, if you have had one VOC, the chances that that person is going to live is 10 years lesser than his counterpart who did not have it. So this is based on a study from emergency department who has come. I mean, patients who have come to the emergency department. Next slide. So again, it can affect all the kidneys, as I mentioned, brain, kidneys, reproductive system, lungs. Essentially, the quality of life of the person is markedly reduced if a multiple veno-occlusive crises happen. Next slide. So these are all the potential problems or complications in acute setting and in a chronic setting a patient with sickle cell disease could have. And that is where you and me have to come in. And if you look at it, imagine the number of specialties who would be involved in looking after these patients. Surgeons are required for the leg ulcers. You need orthopedicians for vertebral collapse. You would need hepatologists for liver cell failure. You need the nephrologists for the nephropathy. You need a pain clinic to manage chronic pain. And many of them will go into addictions because of chronic pain, and you give them morphine and neglect. And one thing after the other can worsen the situation. So the point is that as it is a multicellular, multi-system issue, we have to collaborate. You and me will have to collaborate to treat this across the specialties. Next slide. There are various practical approaches we can do. By hydration is one important thing. Adequate sleep, temperature management, blood transfusions. Next slide. Next slide, please. So there is a role for blood transfusion and other medications that is minimum. Why do we need blood transfusion? You need to keep it less than 10. If you give more than 10, the chances of clotting thrombosis is much higher. Uh, it also improves the oxygenation. If you don't give adequate oxygenation, the sickling chances of polymerization increases. So maintaining the adequate hemoglobin is important. It is also important to maintain the HbF levels so that the HbS proportion comes down. Now, all that can be done by various methodologies using drugs. So, in my talk, I wanted to get to you the point that it is more than what it meets the eye, more than the red cell sickling. There is inflammation, adhesion, interplay of red cells with endothelium, neutrophils, and platelets. And we need to target these to actually get the effective cure. Next slide. So I'm proud to introduce our DM resident, second year DM resident, Dr. Ketan Modak. He's from Nagpur. His state is affected with, that is one of the predictions, prevalence of sickle cell is much higher at the belt of Madhya Pradesh and Maharashtra. And I would like to invite him to give you an overview of therapeutic options in sickle cell disease. Over to you, Dr. Ketan.
Thank you, sir. Thank you for giving the opportunity. Good evening, one and all. So, next slide, please. So, before going to the main therapeutic options, I would like to impress upon you two facts. Sickle cell anemia patients, they have decreased quality of life or poor quality of life. As we can see, there is absenteeism from school, hospitalization is there, personal relationship might get affected, there is acute and chronic pain which may have emotional impact and all this. Next. And also there is increased mortality, the most common cause of death being acute chest syndrome. Okay, so coming to the therapeutic options, next slide please. So hydroxyurea has been the mainstay of the treatment since 1980s. It has been in the treatment options for sickle cell anemia. It has been the only treatment option, in fact, which was used all over. And actually it got approved for the pediatric age just 3 years back. Other treatment options which are there are crizanlizumab, L-glutamine, voxelotor. And there are some other options which are in the pipeline like LMWH, which is tinzaparin, there is N-acetylcysteine, there is bosentan, and etc. Next slide, please. I would be mainly focusing on hydroxyurea and crizanlizumab. Hydroxyurea, as it is mentioned here, it's the mainstay of sickle cell disease. It's a gold standard treatment. Why it is used in sickle cell anemia? It's because it induces production of HbF. This will reduce the HbS polymerization. Also, it causes reduction in neutrophil and reticulocyte counts, decreases neutrophil and reticulocyte adhesiveness, thus improving the blood flow. Also causes release of nitrous oxide and reduces RBC hemolysis. Thus, in turn, it will improve the clinical course of sickle cell disease, reducing the annual rates of the crisis and longer median time to first crisis and the second crisis, which was found in the studies. Next slide. So despite of these advantages, there are few challenges. Those are the concerns which are faced by the physicians, pediatricians, that it's a chemotherapeutic drug, it may cause infertility. Still, we don't know why few people respond to hydroxyurea, few people don't respond to hydroxyurea. And we don't have syrup form for hydroxyurea. We don't have liquid form for it. We have to, it's a big size of capsule and we have to give it to pediatric patient. It becomes difficult. So next slide, please. So these are the challenges which we face. One is pain, which is a subjective feeling and we don't have any clinical correlate for that. Plus many a times the communication between the doctors, the healthcare professionals and the patients is not very good. So what we require is that we require better education. We require appropriate use of hydroxyurea and novel mechanism based targets for VOCs, as sir has just told in his talk. Next slide. Next slide. This is the cartoon which, no, please go. Yeah. So here we can see there is a complex interplay of various molecules along with RBCs, WBCs and all P-selectins, E-selectins, integrins, as sir has already discussed, and we can target each of them as you can see in the diagram. Next slide. Coming to crizanlizumab, it's a humanized monoclonal antibody. And the target for crenalizumab is p-selectin. So a sustained study was done by Novartis, which was a double-blind, multi-center, placebo-controlled trial. There was stratified randomization was done using whether the patient was taking hydroxyurea or not taking hydroxyurea, and depending on number of crises. And the patients or the subjects, they were randomized in 1:1:1 ratio, that is 5 mg per kg of crenalizumab versus 2.5 versus placebo. And next slide, please. What they found out that was there was significant reduction in vaso-occlusive crisis with 5 mg per kg dose of crenalizumab. Next slide, please. Also, when the subgroup analysis was done, they found that throughout the subgroups there was reduction in the vaso-occlusive crisis, whether they took hydroxyurea or they didn't take hydroxyurea, or whether the number of crises was less or it was more. Next slide, please. So hence the crenalizumab was approved for the patients, that is age group of 16 and above, in 2019, and it can be used to reduce the frequency of vaso-occlusive crisis. So apart from the therapeutic options, what other important thing which we should keep in mind is that most commonly sickle cell disease vaso-occlusive crisis is precipitated by infection. What is the direct effect of the infection is that the circulating leukocytes and the inflammatory cytokines which are released during the infection, they predispose the sickle cell disease patients to pain crisis. Also, there is some indirect effect which is caused by dehydration, secondary to some renal impairment or secondary to sweating, anorexia, nausea. Hence, next slide, please. Hence, immunization plays important role in preventing, like at least the vaccine preventable infections, and the pneumococcus, meningococcus, H influenza type B, and influenza viral infection vaccination must be given to these patients. So summarizing everything, next slide, please. Vaso-occlusive crisis may be only tip of iceberg, as Sir has already told, when it comes to ongoing vaso-occlusion. Multicellular adhesion, it promotes vaso-occlusion and vaso-occlusive crisis. It's a vicious cycle in sickle cell disease. Vaso-occlusive crisis has been associated with increased risk of death at early age. It is usually managed with hydration, supplemental oxygen, proper analgesia with morphine, NSAIDs. And there are a lot of novel agents which are coming in nowadays. Hopefully in coming future, we will have a lot of agents to treat this vaso-occlusive crisis and give them a better quality of life. Thank you. Over to you, sir.
Thank you, Dr. Ketan. And can you go to the next slide, please? Okay. So look, we would have loved to have all of you who have registered into this quiz. We have more than 800 participants now who have been able to log in. And looks like we have to disappoint 3/4 of the candidates, and we are extremely sorry for that. We will share these question bank with all of you who have registered, and that is the only thing I can say. You can get a score for yourself. You can see what could have been if you had registered. And of course, I'm talking to only those who have been able to log in and not to the others. We will work with Mice Ideas to see how we can increase the speed of logging in the future. So since we have almost crossed 6:35, 6:40 and more, it is important that 6:45 now. So important that we go with the screening test with whoever could participate and get the finalists to start the quiz. So just to give you an overview of the screening test, how it is going to be. Next slide, please, Somnath. So of course, many of you have logged in, and you have the login. Of course, you have seen this, and many of you could not probably log in before this. Next slide. And what you see on above is ask a question. If you have a problem during the quiz which is happening, you can ask the question. We may not be able to address it immediately. However, it will help us to understand a bit more detail on what is happening. And that is the quiz. When you click on the quiz, next slide, you will see your email ID and password popping up. And at that moment is when the link will be shared to all. and you will get to the question paper. Next slide, please. And that's a trial quiz paper. This is how it will look. You need to fill in your name, email ID, and phone number. It is important. And we will cross verify this with the details of what you had already registered beforehand. You have a total of 20 minutes from the time we start the quiz. We will stop taking any more submissions after 20 minutes. The quiz we have did dummy rounds will take about 15 to 20 minutes to read through the whole thing and do. If you see that the question is too long and you are unable to read through that, you may have to probably skip that question and go to the other one. You will be able to view the score while you finish the questions, and you need to come back to the original link for proceeding for the further proceedings. We may have to take a 5 to 10 minutes break there while we analyze the results which have come in. We have a team at our backend who's looking at the time to submission and the scores. We will contact the finalists on the phone. So that 5 minutes, many people will be contacted, 6 of you. If you can't contact, the net is down or whatever, we will call the next contestant. And probably we won't be able to say who got in the first. We will show you finally who are coming into the finals. Next slide. Okay. So I will ask Mr. Somnath to make the questions live now. And 20 minutes from now would be coming back. Over to you, Somnath.
Yes, sir. The quiz is live now.
Okay. All of you may please start taking the quiz. We've had an unprecedented traffic in the networking, and so we've had a problems in many of you were disappointed. Some of you could not even log in.
First and second.
I am extremely sorry that we could not take everybody into consideration, but with top 6 finalists already chosen, we are going to roll out the quiz. And before that, we would like to give you a brief on how the entire quiz has panned out with regard to the registration, so that we learn from these experience we've got. So today is the grand finale of the 6 top participants. I'm yet to see the scores of the top 6 is ranging from 38 to 50. That's fantastic. And we will come back with more details of the participants very soon. Next slide, please. So we've had about 3,253 responses in 9 days. Contestants were 2,691 and 562 spectators. And as I understand, we are unable to, we have got only about 1,000 people able to log in, and many of you are unable to log in. Next slide, please. It is a female predominant participation, and I understand that that would be probably proportional to all the gender-based admissions, females having preponderance of having chosen MBBS, or maybe they are the ones who are choosing to participate in the quiz. And we will know from the top 6 finalists whether it is all males or a female, all female team. Next slide, please. That is the spread of the registrations. Most of the students have been in second year, and followed by third year, and then followed by first year, and very few from interns and final years and fourth year. Okay, next slide, please. We've asked everybody what is their expected specialty, and it is divided among the 30% each, almost. Medical being 38%. So obviously those are the people who were more interested in taking up this quiz. Next slide, please. So that is the most heartening part of the quiz, I must say. The Karnataka, that is the total number of medical colleges. I'll come back to the number of students participated from each state, and we will probably give you the average score of the state in the next slides as well. We have 534 MCI recognized medical colleges in the country, taking in almost 80,000 students a year. And the top 3 medical colleges, the number of colleges wise, it is Karnataka, followed by UP, followed by Maharashtra, then Tamil Nadu. However, if you look at the number of students coming in per year, next slide, please. The number of students coming in are most from Karnataka, followed by Tamil Nadu. And we have, yes, the seats distribution is from Karnataka, followed by Tamil Nadu, followed by Kerala, Andhra, Rajasthan. Why I'm putting this point is to show a statistics on the participation from various states. Next slide, please. So that is the total contestants. We had a neck-to-neck competition between Karnataka, Tamil Nadu, and Punjab from the start of the quiz. And in the last lap, it is actually the Tamil Nadu and Karnataka who have won the number of participations. So obviously we would expect the winners from Tamil Nadu or and other places. But it's interesting, I just got in the results hot. 4 of the top participants, the finalists, are from Tamil Nadu. So a big congratulations to Tamil Nadu. We are yet to see the colleges which are coming in. Arun will come back with the details of that. 1 from Punjab and 1 Telangana. So that's fantastic. Nobody from Karnataka or Kerala, Maharashtra. Obviously, I've got somebody telling me from Kerala that they're unable to log in, and I understand that. And hopefully by next time, we will rectify those problems. And although it was 55% female dominated quiz, we have 4 males and 2 females. More details to come in on their individual interests and colleges. Next slide, please. So that is the number of seats each states have and the participation on the other side. So obviously, proportionately, Karnataka had more number of seats, but Tamil Nadu had more participation. Next slide. So that's number of seats per year and the registration. So next slide, it is not very clear. I'm not getting into the details. So that's a contest. Next slide, please. That's a distribution of contestants and spectators. So obviously a quiz is successful when you have more spectators. And of course we failed miserably in the IT pit today to accommodate more than 1,000. So it's a big lesson learned. We'll come back with rectification processes for that. The spectators were maximum from Tamil Nadu, followed by Punjab and Karnataka. Next slide. So the 6 top who have come in had a combination of brain and speed, and of course a strategy on how to attempt some exceptional answers. Some of them 49 and 50, exceptional, fantastic. And it was unbelievable for our team. We were just looking in as the results were coming in. We made phone calls to find out if they had help, and we cross-checked with them. And that is what we have got chosen the 6 top as the backend team is working. And we have a quiz intelligence team which is working at the backend, looking at as the results are coming in to verify who's from where. So all that has been done, and that is what we had taken time for. Okay, next slide, please. So that's a top 6 finalists, and a huge round of applause to them. So Jaswanti, followed by Gautami, followed by Anna Matthew from Vellore. The others are from Siti Sai Sai Medical College Research Institute. 2 from Sri Satya Sai Medical College. Fantastic. 1 person from Rajiv Gandhi Institute of Medical Sciences. Anna Matthew from Vellore. Paras Mahajan from New Delhi, and Arunishwar from Tanjavur Medical College. We'll have Dr. Arun with us, who will be introducing with them and bringing them to the podium with the video calls. Initially, we thought we will discuss the questions also with you while we were waiting, but we need to proceed. It's already now 7:30. We would definitely send these links to the question paper for you to practice on what we did very soon. Next slide, please. We have about 6 rounds. Each of these rounds will be discussed with you in detail. And of course, some of you may be having sailed through on this, but this is an interest we will develop to look at the history as well. We have called it antiquity round to look at history and trivia. Eagle's eye for your keen observation. What meets more than the details, what you will see more than what meets the eye. Then there is a detection round in the linear fashion. Then there is a deduction round, which all doctors have to engage in, like Sherlock Holmes. Then there is a progress round on advances, but as it is accompanied with the casino style, you can lose or gain as well. So you need to choose whether you want to play up. Then there is a blitz round with a 60-second dash, 10 questions in 60 seconds. You decide whether you want to pass or move on, and then you can gain all what you lost or lose all what you gained during that round. Next slide, please. If there are tied scores, which I hope will not be there, it will be a bit tough for us to conduct that, but we said we will do a super over there of 3 questions each. Next slide, please. And like IPL, if the super over is tied and we need to have another super over, or we need to decide whether we should share the prize money. Next slide, please. So I have Dr. Arun, who will be taking the first round, and I will invite him onto the podium to introduce the finalists, and they will come and you will see them on a different portal now, and you will see their videos and get more out of their interaction. Over to you, Dr. Arun, and thank you and all the best to all the participants to have a wonderful time of entertainment, rather infotainment or hemotainment, as Dr. Pankaj mentioned. Over to you, Dr. Arun.
Yeah, Somnath, can I have all the team members on board?
Yeah, if the team members can just start their videos.
Yeah. Can the participants hear me out?
Yes, sir, I can hear you.
Anna, you can hear me? Gautam, what about you?
Yes, sir.
Thank you. Paras,
Yes, sir.
very nice. Yuvasai Kumar,
Yes, sir.
yeah. So we have one more participant. Where is this?
Yeah, she logged in and then she has some network issues, so she has logged out. She's joining again.
Okay, so we will rather I will try to introduce the other participants. So Anna, can kindly introduce yourself to the crowd. You need to tell us which year, college, date of joining maybe, and your aspirations. Yeah, please go ahead.
Sure, sir. I'm Anna Matthew from Christian Medical College, Vellore. I'm in final year. I joined on September 2016, and as of now, I'm more interested in taking medicine and maybe becoming a clinician researcher, but I haven't made up my mind conclusively.
Yeah, that's great. Good to know formative years. So a lot of time to catch up. Yeah, may I have Yuvasai Kumar kindly come on stage and introduce yourself.
Sir, I am Yuvasai Kumar from Rajiv Gandhi Institute of Medical Sciences, Adilabad, from Telangana state. And I am a final year student, sir. And my aim is to become an endocrinologist.
That's really nice to know. I think maybe at the end of the quiz, you are inspired to take up hematology. Thanks for joining.
Thank you, sir.
Mr. Gautam, yeah, you need to tell us more about yourself. Yeah, go ahead.
Gautam from Sri Sathya Sai Medical College, Tamil Nadu State.
Yeah, and about your aspirations, have you made up your mind yet? Flying to US, Canada, or staying back and helping the poor out?
Staying back hometown.
That's nice to know. Yeah, Mr. Paras, kindly introduce yourself to the crowd.
Hi, everyone. I'm Paris Mahajan. I'm from Vardhman Mahavir Medical College, Delhi. And I'm a final year student. And I hope to take MD medicine. But I'm not yet decided.
Nice to know that. Miss Jaswantani, maybe if I pronounce your names wrongly, you can probably correct us.
Yes, sir.
Yeah, we would like to hear you out. Yeah, you did pretty well in the screening question. No, kindly wait. I think there is some echo. So just look at your.
Good evening, all. Myself.
Maybe I think you're sitting with one more contestant, or I think you're from the same college. Is that correct?
No, network connection is slow here. It's raining here.
Okay, that's fine. Yeah, now we can listen to you better. Yeah, go ahead. Yeah, this one thing we couldn't hear you out. Kindly reintroduce yourself.
Hello.
Yeah.
Myself, Jashwantni from Sri Sathya Sai Medical College, Tamil Nadu, studying third year.
Okay, and what have you decided for your future? Yeah.
Like each year it's changing, sir. So I haven't decided it fully.
I know.
Each year having each interest in each science.
Go with your passion, and I think you're passionate about hematology. That's why you've done so well in the screening. Keep it up. Yeah, we move to the last contestant, Mr. Aruneshwar. Kindly let us know more about yourself.
Hello, I am Aruneshwar from Tanjavur Medical College, and I am passionate in doing general medicine for my post-graduation.
Yeah, that's one of the bedrock of practicing hematology. We need to have good general medicine physicians coming up and taking up hematology in future. So all the best to all of you. We will start off with the first round. Okay, we'll go slow, and then as soon as you get comfortable with it, we'll catch up with the pace. Yeah, so we have the first round here. So to pay respect to our predecessors and what we learned from the mistakes which were done, and definitely the strides we had in past, we would actually want the antiquity round to be first. So it has been named the Me First round. So it's all about legends and amusement. If we will focus on the history and trivia here. So the questions will move from participant A to F. So participant A is Jaswantini, B is Gautam, C is Anna Matthew, D is Yuvasai, E is Paras, and F is Aruneshwar. Okay. So we have 15 seconds for direct question. We have a timer. You will see the timer when I start the round. So only the participant being asked the direct question is to answer first. Others, if they know the answer, they would only type yes in the chat box. Okay. So there is a response box. You can see to the right. All of you can actually type in yes if you know the answer. But kindly don't type out the answer so that it becomes, because it's accessible to everyone else. So if the participant who has been given direct question fails to answer, the person who has typed yes first will be given the opportunity to answer. And if he is wrong, the question will be passed to the next person. And that is based on the time to response. Okay. So marks for correctly answering the direct question in this round is 13 and 15 for the past question. However, the caveat is if the answer is wrong after entering yes, the candidate gets a -5, irrespective of whether that's for the past question, of course. So what would be the maximum points which could be gained in this single round? You can make out it's humongous 105. Okay. So we have tried to keep the rounds balanced it out and the points are spread out. So there is a lot of time to catch up. Stay cool. So what is the maximum of points you lose, or what is at stake is 30 if you go all wrong. Okay. So I have some questions from the no negative scoring for direct questions. So can I have the next slide, please? So we do a dummy first so that you get comfortable with the system. So that's what we have tried here. So this is a dummy question, and this is for participant A, that is Jaswantini. So you try to answer, and if you know the question answer, you try to answer it out, and definitely other people can fill in the chat box. I told you the way you have to fill in is yes if you know the answer. So the question is, X is a diagram that is used to predict genotypes of a particular cross or breeding experiment. It is named after Mr. X, who devised the approach in the late 19th century. It's used till date by biologists and all of us to determine the probability of an offspring having a particular genotype. So you need to identify X. Jaswantini, this is not a pure hematology question, it's a dummy question. So you know the answer?
Hello. It is Mendel's dihybrid cross.
So that's okay. I would want the others to respond by this time. So I hope nobody has responded. That means nobody knew the answer. So 15 seconds is for a direct question. So I have finished with my 15 seconds. Nobody has responded yes in the response box till now. Are you comfortable with the rules which I told you? Have you understood? So 15 seconds is the time given for a contestant for a direct question. So all others who know the correct answer, during this 15 seconds, you need to plug in yes. So Aruneshwar has said yes, but you have responded after 15 seconds. But yeah, let me just hear it out from Aruneshwar. Yeah, what was the answer, Aruneshwar? You want to tell me now? You need to tell me now the answer, Aruneshwar.
Hello, am I audible?
Yeah, you are audible. You are audible. Jaswantini, the answer is incorrect, which you gave. Okay. And Aruneshwar, can you hear me out? Aruneshwar, can you hear me? Aruneshwar, you're having a network issue probably. Aruneshwar, can you hear me out?
Sorry, there was a small technical glitch. There was a network error in my mobile. So
you responded yes. You want to answer the question?
So it is a... No, I was just actually wanted to verify that. I'm not sure of the answer.
Yeah. So it's okay. You did dummy also from your side. That's fine. So go ahead. So the correct next slide, please. So the correct answer is, can I have the next slide, please? Yeah. So this is the Punnett square, okay, and it's named after Reginald Punnett. So we move to the next. We move to the round one proper. Can I have the next slide, please? So no, yeah. So all said. No, please go back one slide. Please go back one slide. Yeah. So all said, I believe you have understood the way you have to respond Yeah, we go to the first contestant. Dr. Jaswantini, the question is for you. Okay, I'm going to read out the question. You have 15 seconds to answer. Yeah, we can have the first question. So this is for Ms. Jaswantini. So you need to identify X and Y here. Okay. So X is a clonal disorder, but not a malignant disease. Males and females are affected equally through the mutant gene, X-linked. This gentleman, Dr. Louis Pellimer, was singularly responsible for delineating the link between the disease X and system Y. But regrettably for him, his doubt existed in the community of the existence of the entire system in humans. And he did actually commit suicide after barbiturate overdose because he was depressed, because the entire scientific community would tend to prove him wrong. 10 years after his death, he was vindicated when the entire scientific community discovered the entire system Y, which he had identified. And the entire disease X had been an enigma for a period of 111 years. Yeah, your time starts now.
Sir, it is paroxysmal nocturnal hemoglobinuria, sir.
So that's one part of the answer. That's correct. It is a
hematologic disease.
Oh, Jaswantini, please stick to the correct answer. So it is definitely the disease is paroxysmal nocturnal hemoglobinuria. But you need to tell me what is Y.
System involved is hematology system, sir.
Okay, so I wouldn't grant you that. I will give you half a mark for that. So that means you will get 15 for that. But has anybody else answered for this? I think nobody else has responded yes. So that means nobody else knows the answer. So it is the alternate complement system, which is defective. And for the first time, it was discovered by this gentleman. And the scientific community would not be ready to accept it. So 15 marks for Jaswantini. Go ahead. Next question, please. Yeah. So this is for Dr. Gautam. Gautam, the slide looks complicated, but your timer would start when I finish reading out the question. So just hold on. So you need to utilize whatever is shown in the diagram to come out to a conclusion. So this is about a 1958 description of a syndrome, which actually was described in 20 patients by a gentleman, and the syndrome is named after him. If you read out, you can actually understand that this is a syndrome of hemolysis described in a group of special group of people. So I have made it a lot simpler for you and highlighted what was relevant here. So you need to read out the summary when I finish, by the time I finish, and definitely you can utilize the clues on the peripheral blood smear. But I want you to name the syndrome here. Okay? So your time starts now, Arun. So, yeah. Yeah, so your time is up. I didn't have a response from you, so I mean the question is passed. Jaswantini is the first to respond.
Zeev syndrome, sir.
Yeah, that's an excellent answer. Very good, very good. That's Zeev syndrome for you. Very nice, very nice. Go ahead. Let's move to the next question. So that she gets a pass, 15 marks for that. So the scoreboard needs to be ticked up. So we have the third question for Ms. Anna Matthew from the CMC. Yeah. So I would read out the question for you. During the early 20th century, X was a leading medical cause of death in expatriate soldiers and administrators in colonial Africa and some parts of South Asia. The relationship to drug Y was not universal here, but a series of patients showed that a larger than normal dose of Y preceded X by some hours. Carefully read the question and the diagram which shown. This is actually what is called as a prophylactic ration of Y. And even that they were named the Y parade, because they have to actually protect these soldiers from deadly disease. So you need to name the entity X and the drug Y. Your time starts now.
Sir, I'm not sure. Is the disease malaria?
Yeah, so the time is up. So I wouldn't give you marks for that. So has anybody else replied here? I think Jaswant is the only one who has responded here. Yeah.
Is it diclofenac, sir?
Oh, yeah. So that means she gets a negative marking here. So she gets a negative marking here. 5 marks negative for this one. So the disease is black water fever, and it was classically described with quinine use. So this is a quinine parade where soldiers were perforce given quinine in an oral decoction form, and they would end up succumbing to black water fever, and that is a subset of malaria patients, not all patients. So that would be the complete answer. Can I have the next question, please? Yeah, question 4. Sai Kumar, I think you're ready. So lengthy question, but a simpler answer. Utilize the clues in the questions and the diagram, which follows. So the design, development, and clinical use of L1 is a unique case in drug development. And it was actually academic efforts from a charitable organization. It was labeled UKTS in 80. But definitely the embargo imposed by the support group ensured that nothing could be published for 5 years. However, the multi-center trials picked up because there was an easier way of synthesizing L1. And definitely, even after this, no pharmaceutical company would take it up on a bigger scale. And India had to play a lead role there, thanks to a parent of a patient with disease X and to the pharmaceutical company in India as such, who would actually launch the landmark trials in India. And in 95, it finally became commercially available. And it revolutionized treatment of X worldwide. Next slide, please. So this was the first preparations, large gelatinous capsules, which had to be swallowed by the patients. And you can see the urine samples before and after you swallow the pill. So, Mr. Sai Kumar, you need to tell me what is L1, and your time starts now.
Sir, I'm not sure, but I think it's eculizumab.
So that's a wrong answer. So has anybody else responded here? I think there is no response here from any of the other participants. So this is deferriprone, and the disease is thalassemia. So you should not forget this drug and the disease. Both have saved millions of lives. Go ahead. We move to the next question, please. This is for Mr. Paras Mahajan. Again, presence of mind is what is important this round. So this is the landmark publication, This is a landmark publication which came in the Journal of Science in 1956, based on experiments conducted by Carson and the team. In fact, that time you could use prisoners in captivity and they could do experiments on them. So this is actually an unethical trial to start with, but they did publish it up and actually made a difference in the lives of many people to follow. You can use clues in the diagrams, which are shown on the right side. So the one on the top is a peripheral blood smear of the patient, the disease X in question, and the one below is the prevalence in the community as worldwide prevalence data goes. We move to the next slide. So what I need you to tell me, Mr. Paras, is you need to tell me the drug Y in relation to which the disease was first described. And you also need to tell me one of the two cells which you would see in peripheral smear of this patient with disease X following exposure to drug Y. So your time starts.
So disease is G6PD deficiency.
That was not a question. Yeah, go ahead. Go ahead.
And drug Y, I'm not sure, maybe primaquine. And cells, one of the cell can be a bite cell or degmacytes.
I give you full marks. Beautiful answer. G6PD deficiency, first described with primaquine. They are bite cells, which you see, and you do see hemighost also in the peripheral smear. So full marks to you. That makes 30 marks for you. Go ahead. We move to the next and the last question to participant Aruneshwar. Again, presence of mind here. So you have X, which was discovered in the late 50s as a metabolite of soil bacterium, Streptomyces pilosus. And it was pure coincidence working here, serendipity everywhere, because the primary intention of the manufacturer was to develop an antibiotic. But since its launch, it has saved millions of lives from fatal complications of a common disease. And this would be the first, actually, the drug is shown here, the way it was delivered, and you would see that the way it has refined and mattered to many millions of lives suffering from disease X. So I need, next slide, please. Next slide, please. So you need to tell me what is the drug X in question. And definitely the second part is to now tell me what is the unique infectious disease complication associated with administration of X. That Aruneshwar?
Is it desferrioxamine?
Yeah, that's a perfect answer. You get the half part right. But you need to tell me the infectious disease complication here.
The infectious disease could be mucormycosis, fungal infection.
So I give it to you. The drug is desferrioxamine, initially marketed as an IM formulation. The infectious disease classically was Yersinia, but yeah, it is siderophore. Mucormycosis is definitely one of the complications you can encounter. I would give it 30 marks to you from an MBBS student if you answer that. That's a wonderful answer. 30 marks to you. Great. So we have the final scorecard here. Next slide, please. So I think the two are on the tie with 30. 3 need to open up their accounts. Jaswantini has done a good start. Maybe she lost some 5 marks. That's okay. A lot of time to catch up. And it's my proud privilege to introduce you to the question quiz master for the next round, Dr. Preetham. Can I have the next slide, please? Yeah, he's a charming young fellow. He's doing his DM with me in PGI Chandigarh, and he's in the pediatric hemato-oncology side. Over to you, Dr. Preetham.
Thank you, sir, for the kind introduction. Am I audible to all the 6 contestants over here?
Yes.
Right.
So you're audible, but you're quite soft.
You mean my voice is muffled?
Yeah, it's slightly muffled.
Okay. Can you now hear me clearly?
Yes. Everybody else is
Right. So, good evening, everyone. Congratulations. You have really done excellent in the preliminary rounds. And may I welcome you to the second round. So this will be a clinical case-based round. We have given the name of Eagle's Eye round, where you have to be super focused like the eagles for the prey. So basically, it focuses on your skill to see more than what meets the eye. So where I will take you through 6 different clinical scenarios. And just like the previous round, in this round also, the questions will move from participant A towards participant F. But unlike the previous round, here there is no passing option. That means my question will basically have 2 parts. The first part will be giving you a clinical scenario along with some clue, which will be there in the first slide itself. And it will be directed to a particular participant. And you have to answer within 15 seconds after I have completely read out the question. Now, if you can answer, you will get 30 marks. But if you can't answer within that 15-second time period, then I will move to the next slide where we'll be given one more clue. That could be some graph, it could be some other picture, it could be some molecular mechanism, anything. Right. So, so after that clue, if you can answer, then you will be awarded half marks. That means 15 marks. If you can't answer even after that, then any of the other 5 participants are welcome to answer, but that participant will not be awarded any specific marks for that. So is are the rules clear to all of you? Should we proceed? I will show you a dummy question as well. Next slide, please. Next slide, please. Right. So it's just a dummy question, maybe to Anna. So Anna, let's say we have this question. So we are dealing with a 22 years old young lady who presented in hematology clinic with pancytopenia, and on examination, you could not find any organomegaly in the patient. But while examining, you found that it was an incidental finding that the patient has subtle left-sided hemiparesis. So you took a detailed past history, and you found that the patient had a history of stroke in the right middle cerebral artery territory some 5 years ago. And she also gives a history of passage of one episode of cola-colored urine some 6 years ago, which was not been evaluated properly. So can you please the diagnosis? Your time starts now.
So I'm not very sure actually.
No issues. No issues. Let's proceed to the next clue. Next slide, please.
Right. So this is a flow cytometry of granulocytes of the patient. Can you now guess the diagnosis?
Yes, a paroxysmal nocturnal hematuria. Based on CD59-55 and in the past history, the cola-colored urine.
Right. So it is paroxysmal nocturnal hemoglobinuria, not hematuria.
Yeah, sorry,
So,
sorry.
right. So it was just a dummy, no issues. So if you can answer like this after getting the second clue, you'll be awarded 15 marks. So is the rule clear to all participants?
Sir, is there any negative marking?
Nothing. No negative marking. Don't worry.
Dr. Preetham, I just want to add, please don't type your answers in the chat box.
Sure.
Dr. Yuvasai, you have typed PNH in the chat box. Please don't do it.
I did.
Yeah, the question goes to other participants only after the second clue is over. And even after attempting the question, you are not going to get any marks. So, right? So please don't type.
You might just give away the answer to the person knows, and you may lose, you'll come down. So as you said, you start with 15 and you can get a maximum of 30 in these rounds.
Right. So so we'll start the core part of this round. So general suggestion to all of you, think hemolytic. We'll be taking through difficult clinical, varying clinical situations. Think hemolytic in back of your mind to clinch the diagnosis. So all the best. Let me introduce the first question to Jaswantini. Sorry. Right. So this is your question, Jaswantini. So we are dealing with a 12-year-old adolescent girl who presented with history of intermittent jaundice from early childhood. You examined, and in examination you found the patient to have splenomegaly 7 centimeter under left costal margin. A peripheral smear examination was done. There was microcytic hypochromic anemia, and I've attached a hemoglobin high performance liquid chromatography curve of this patient. So from this, can you cleanse the diagnosis? Your time starts now.
So is it hereditary spherocytosis?
That's not the answer. I will give you the second clue also to help you. So can we see the next slide, please? I have nothing to say. Just see this picture and try to cleanse the diagnosis now. Your time starts now.
So beta thalassemia, sir.
Okay, so I think we'll close this timer. So that's not the answer. Answer here is a compound heterozygosity of HBE beta thalassemia. In the HPLC curve, there was significant elevation of HbA2, and we know that HbE is a abnormal hemoglobin that co-elutes with in the region of HbA2 in HPLC curve, and there was marked elevation of HbF as well. And I have also shown that the northeastern states, so Kolkata, parts of Bengal, Assam, the northeastern states are having higher prevalence of HbE disease and HbE beta thalassemia. So that was the diagnosis. So Jaswantini doesn't get any score in this round.
The beta thalassemia, is it so any grace score, sir?
No, sorry.
No grace mark, sorry.
I'm sorry.
Okay, so thank you.
Don't get disheartened. There are plenty of rounds still left to cope. Okay. Can we have the next question? And the next question is directed to Gautam, Mr. Gautam. So your question. So we are dealing now with a 13-year-old boy who presented to a neurologist with history of recurrent strokes since 8 years of age. And there is also moderate degree of mental retardation on the assessment of the intellectual functioning. And you reviewed all the past medical records, and what you could find was the infarcts in the brain were actually bilateral multifocal. There was no particular vascular territory involvement. On examination, the child has mild pallor. I have attached 2 images you can see. One is a MR angiography image, and that is a peripheral blood smear. With this, can you clinch the diagnosis? Your time starts now.
Sir, chronic disorder anemias.
You have to be more specific. Time is over. Next clue, please. So you probe the further history of the patient, and you got the history that during childhood years, the child had few episodes of such painful swelling of bilateral hands. Now, can you please the diagnosis? Your time starts now.
Autoimmune immunity hemolysis.
No.
Hemolytic anemias.
Sorry, that's not the correct answer. Can any one of the remaining 5 participant volunteer?
Sickle cell anemia.
Great. Sickle cell anemia. Can you exactly that's the answer, but can you complete the diagnosis? So
Hand and foot syndrome.
Hand and foot syndrome in the childhood. And now what is the cause of recurrent stroke? It is Moya-Moya syndrome. Secondary vascular complication in the great vessels in the circle of Willis, right? So the Moya-Moya syndrome he has developed. That's the reason of mental retardation and recurrent stroke. So that was a complete diagnosis. So I'm sorry, Mr. Gautam doesn't get any score in this round. Can we proceed to the next question, please? Right. So next question is to Miss Anna. So ma'am, this is a 24 years old young man who presented with complaints of backache for last 3 months. And also for last 2 weeks, the patient is having bilateral progressive lower limb weakness along with new onset urinary dribbling. On examination, you found the patient to have splenomegaly, bilateral leg ulcers, distended jugular veins, and there was loud P2. So I have shown you one coronal imaging of the thorax. And at the same time, I have shown you a histopathology of a true cut biopsy, which has been performed from this abnormal mass in the paravertebral area that you can see. Can you please the diagnosis? Your time starts now. Okay, time is up. Can we go to the next slide, please? Okay, so this is HPLC of the patient. The clinician who was managing suspected a hemoglobinopathy, and that's why this investigation was being performed. So where you can see the abnormalities being highlighted as well. Your time starts now.
So in view of the high HPF and on the in the previous slide, the patient had pulmonary hypertension as well as this thing, mass, a mediastinal mass. I would say it's I was thinking of sickle cell disease, but I'm not sure.
No, sorry. Any other contestant who want to volunteer?
Is it the hereditary persistence of fetal hemoglobin?
No, sir. That condition is largely asymptomatic. So we have this condition is basically a thalassemia intermedia, and here the cause of having a paravertebral mass was extramedullary hematopoiesis happening at an ectopic site in the paravertebral area, which was also causing spinal cord compression, and that's why you were getting paraparesis with bladder involvement. So the complete diagnosis would be non-transfusion dependent thalassemia, or so-called thalassemia intermedia, beta thalassemia intermedia, I mean, along with extramedullary hematopoiesis at the paravertebral area with spinal cord compression. So I'm sorry, Anna doesn't get any marks in this round. Can we proceed to the next question, please? Right. And the next question is directed to Mr. Yuvasai. So, sorry, your question. So here we are dealing with a 34 years old young man who presented in emergency room with acute onset headache, dizziness, and shortness of breath. On an examination, what you elicited is the patient was having central cyanosis, which is been shown in the picture also. You took a saturation record and it was 85% in the room air. You started on nasal prong oxygen, but even after supplemental oxygen, there was no improvement of saturations. You did an arterial blood gas analysis, and what was remarkable was there was significantly elevated methemoglobin percentage, which was 36%. So as a management protocol for methemoglobinemia, you given IV methylene blue. Now, after that, you expected a recovery to happen, but rather paradoxically, the patient worsened after giving methylene blue. Can you get the diagnosis? Your time starts now. Sorry, have you got disconnected?
Yes, sir, he has got disconnected.
Right.
So we move to the next participants, or you can give the answers basically.
Can't we wait for a few seconds?
Yeah. So this we will see. Look, this is going to happen unexpectedly. So we will decide upon this situation from the quiz master to decide. Maybe a few minutes, and then others.
Yes,
hopefully,
sir.
he had a problem there. It's a genuine.
Right, sir. Yeah, I think we can wait for a few minutes.
The question is, will they get time to refer or ask and come? So we'll give decent seconds only, and then we may have to proceed. So I'm making the call now because we need to proceed, Preetham. So
Right, sir.
go ahead. I mean, get it nullified. That's all we can do now.
Right. Can any of the other contestant have guessed it? Any one of you?
The methemoglobin anemia.
Yeah, that's there that I have shown, but I have given you some additional clue that after giving methylene blue, rather than having improvement, there was worsening. There is a key. Okay, the next slide, please. So here you can see in the peripheral smear, there are multiple bite cells. So it is basically G6PD deficiency. So the learning point here is that in methemoglobinemia, we know that drug of choice is IV methylene blue, but methylene blue is a drug which itself can cause brisk hemolysis in patients with G6PD deficiency. Right, so that was the take-home message from this question. So quite unfortunately, USI doesn't get any marks in this round. Can we go to the next question, please? Next question is directed to Paras. So, sir, we are having a 2-year-old boy who presented with chronic transfusion-dependent anemia since 2 years of life. The mother gives bad obstetric history, that there was one history of sibling death who expired on day 1 of life. And there is also one history of stillbirth. And on examination, you found this index child is having significant growth failure. He has moderate pallor, mild jaundice, and splenomegaly 5 centimeters below the left costal margin. I have shown the peripheral smear and the picture which is there in the clinical picture. You can see a baby who had stillbirth. This we recovered from the hospital record. So can you cleanse the diagnosis? Your time starts now.
So it is alpha thalassemia. The baby is showing hydrops vitalis, which is seen in HBH disease.
So be more specific. What is the exact precise diagnosis in the index child?
Index child will have alpha thalassemia major.
Okay. Okay, I will give you full marks. So basically, we are talking about HPH disease, right? Where 3 of the 4 loci have been deleted, right? So I will give you full 30 marks. So Paras gets 30 marks, right? Can we have the next question, please? Okay, so this question is to Mr. Arunishwar. Sir, so this patient is an 18-year-old boy who presented with acute calculus cholecystitis to a surgeon. But while the surgeon was getting detailed past history, he found that this patient had 3 episodes of blood transfusion previously at 3 years, 6 years, and 8 years of age, respectively. And on examination, the patient was having moderate pallor with jaundice and splenomegaly 7 centimeter below right costal margin. In the hemogram, one striking abnormality was that MCHC was 40, which is strikingly high. Hemoglobin HPLC was within normal limits. A peripheral smear has been done, where you can see there are remarkable feature is target cells are there, and osmotic fragility test was also been performed. So here the red curve is patient, and the black curve is a healthy control. So
is it a hereditary spherocytosis?
That's a wrong answer. Please see the second clue and try if you can pick the answer. The next clue, please. I just want to give you the clue that in the previous osmotic fragility test curve, actually his osmotic fragility is showing in a resistant pattern rather than being more susceptible. Now see this clue. So for this patient, a splenectomy was performed along with cholecystectomy. And after 6 months of splenectomy, he presented with acute onset severe respiratory distress. And you can see that there is a deep vein thrombosis in a leg, and at the same time, there is a large thrombus in the pulmonary trunk. That means there is deep vein thrombosis along with pulmonary embolism. So this happened after splenectomy as a complication. Now, can you pick the diagnosis? Your time starts. Yeah, it's been started already. Okay, time is over. Any guess? Any other participant?
Beta thalassemia major.
I guess I told HPLC was normal, and MCHC showing significant elevation, and osmotic fragility was in the resistant pattern. So the diagnosis here is basically hereditary xerocytosis, which is a dehydrated form of stomatocytosis, in which MCHCs are markedly elevated. And once you do splenectomy, they don't get benefited, and the risk of developing thromboembolic complication gets significantly heightened. So the diagnosis here was hereditary xerocytosis. So Arunishar also doesn't score any marks in this round. So what we can see at the end of this round in the scoreboard that Jashwantini remains in score of 25. Gautam, Anna, and USI are yet to open their score register. Paras is leading with a total marks of 60 as of now, and Aruneshwar at 30. All the best. And the next round will be on a very wonderful round on laboratory hematology, which will be performed by Dr. Pujita. Madam is doing her DM in clinical hematology in CMC Ludhiana. Ma'am will be taking you through a wonderful round on hematopathology. Over to you, ma'am.
Hello. Am I audible?
Yes.
Yes, ma'am.
Ready to go.
Good evening, everyone. Thank you for your kind introduction, Preetham. And this round is basically about the laboratory investigations associated with all the hematological disorders, and our main focus is on the hemolytic anemias today. So the main rules of the round are: each question will carry 30 marks, and each question will be given to each team. This is basically the first question after will go to team A. If the team A person does not answer it, the question will move on to the team B. There is no negative marking in this round, and if the question passes to the next team person, he will get half the score of the question. Direct score is 30 marks, and if the person answers when it has passed to him, the score will be 15 marks. So there is no negative marking, and only one answer that is most appropriate will be considered as the right one, and there is no timer also for this round. Am I clear with the rounds, with the rules?
Yes, ma'am.
Next slide, please. This is a just dummy question, so that you will be clear with the rules of the round. The question goes to Jaswantni. Name the state with the longest coastline in India.
Gujarat.
Sorry, that is a wrong answer. The question passes to Gautam. Gautam, are you there?
No idea.
Andaman and Nicobar.
The question passes to Anna.
West Bengal.
Sorry. The question passes to your side. Hello, your side, your voice is not clear.
Can you type the answer? Can you please type it? Your connection is not good.
Okay. Anyways, this is a trial question. So I'll answer it. The state in India with the longest coastline is Andhra Pradesh. So now we will move to the actual round. Next slide, please. The first question goes to Jaswantni. Here is a 2-year-old boy who is evaluated for apparent ongoing hemolysis. His hemoglobin level was 9.5 gram per deciliter and the reticulocyte percentage was 7%. Platelets and leukocytes were normal. MCV of the red blood cells was around 87 femtoliter. ECT test was done for this boy suspecting a hemolytic anemia. However, it was negative. There was no cold agglutinin also detectable in his serological test. And his family history was also negative for the blood disorders. Next. Kumar, next. This is the peripheral smear, which is showing a typical slit-shaped RBCs, which are also called as stomatocytes. So, my question to you, Jaswantni, which blood group antigen absence can lead to this condition? Which blood group antigen absence can lead to stomatocytosis?
Please unmute. Please unmute, Jaswantni.
Hello, am I audible?
Yeah, Jaswantni, you can answer me.
Blood group antigen is.
Yeah, tell me.
Is it I? Immunoglobulin M.
I'm afraid it's the wrong answer. The question passes to Gautam.
No idea.
The question passes to Anna.
Ma'am, is it Duffy blood group? I'm not sure.
Sorry, it's wrong. Question passes to your side.
USI is not there, so you proceed with the next question.
Paras?
There are no negative, no, in passing.
No negative marking in this round.
P antigen?
Sorry. Then it goes to Araneshwar. No, it's wrong.
Is it RH antigen? RH rhesus antigen?
Yes. Well done, Araneshwar. Now, Araneshwar will be awarded 15 marks for this past question. RH antigen absence can lead to stomatocytosis. Hence, the DCT test was negative in this person. So, we will move to the next question. That goes to Gautam. Gautam, here is the question for you. Mr. A 12-year-old boy presented with history of jaundice and weakness since 3 years. And he was requiring only 2 units of blood transfusion daily. On examination, he was having pallor, frontal bossing was present, and hepatosplenomegaly was also present. Next, please. His lab parameters showed that hemoglobin was in the range of 7 to 9 grams per deciliter. MCV was low, MCH was also low, retic count was high, platelets and leukocytes were normal range, and his peripheral blood smear showed presence of these cells. You have to interpret the slide. And HPLC was performed in this blood. There was increase in the F concentration of the blood. Range, the percentage was 19%, and A2 concentration was 4.8%. With these lab parameters and this background history, can you tell me the diagnosis of the patient?
I'm beta thalassemia major.
It's a wrong answer. Anna?
Hereditary Phagocytosis.
No, only one answer will be considered.
Ma'am, is it concomitant sickle cell disease as well as beta thalassemia?
Well done. It's a right answer. Anna will be awarded 15 marks. Next question goes to Anna. It's a direct question for you, Anna. Name the condition in which you see this pattern in the erythroblast on electron microscopy. You have to interpret from this, you have to correlate these two pictures and answer the condition of the. You have given an electron microscopic picture of a erythroblast as well as a clue for identifying the.
Ma'am, I'm not sure. Is it Swiss cheese appearance of erythroblasts seen in, I would say AML 6? That's I'm not very sure. Basically AML 6 as per FAB classification, but I'm not sure.
Sorry, you were almost correct. It not. You were almost near to that, but it was not correct answer. Paras, can you answer it?
Ma'am, I am here, ma'am. I can answer.
Oh, sorry. Your side, sorry. Your side?
Ma'am, this is a Swiss cheese appearance of erythroblast in congenital dyserythropoietic anemia.
Well done, your side. Your side, you will be awarded 15 marks for this question. Now the next question goes to your side. This is a direct question for you, your side. This is a clinical picture of a child who was having these features on examination. The blood film of the fetus was showing this picture where you can see many nucleated RBCs present in the blood as well as polychromasia was there. And a test was done to identify the condition of the patient. Can you identify this test and can you tell the principle of the test? The baby was having the baby. You can see the baby here is having almost edematous, high drops.
Yes, ma'am.
And his peripheral blood film is showing many NRBCs and polychromasia.
Is Klehoer-Betke test.
Exactly. Well done. And can you tell me the principle also? Anyways, I'll award you full marks to this question, but I will be more happy if you tell the principle.
Identification of fetal HB in maternal blood or?
Yes, exactly. The fetal cells are more resistant to the acid elution, so they are stained bright pink, whereas the maternal cells are lysed. And this is one of the screening tests for the fetal-maternal hemorrhage in hemolytic disease of the newborn. So USI was awarded 30 marks for this question. And the next direct question goes to Paras. Paras, this is a laboratory test which is done to identify a condition, hemolytic condition of the patient. Can you identify the disease of the patient and can you tell me which is this test which will help us to identify the condition?
The disease is PNH, paroxysmal nocturnal hemoglobinuria.
Well done. Yeah.
And the test is a HAM test.
Sorry, this is a gel card test.
Flare test, fluorescent labeled proacrolysine.
No, that is the wrong answer. Anyways, I'll give you half marks for this question. Paras will be given 15 marks. Can anyone try to answer the test?
Gel agglutination assay.
That is wrong. It is a column agglutination test where the gels are marked with the antigens. If the patient has presence of these Merel and DAP antigen, they will have this kind of positivity. If they don't have the antigen, they will be negative for this antigen, and it is called a column agglutination test used for the PNH. So the next question, Araneshwan, this is your direct question. This is the history of a 20-year-old boy with a history of recurrent episodes of pain abdomen secondary to gallstones. And he came with a HB of 10 grams. On examination, he was having jaundice. Splenomegaly was also there. Retic count was 5%. There was a rise in total bilirubin level of 5 grams and indirect bilirubin was also high. The peripheral smear of the patient was showing these kind of white cells as well as hinge bodies on the methylene blue stain. Next slide, please. So a test was performed, and based upon this test, and can you interpret the underlying condition of the patient? This is a negative control, and there is a positive control, and we have a patient sample also here. He is having white cells, hinge bodies on the peripheral smear, and these hinge bodies were present since the birth of the child. So,
is it hemoglobin, methemoglobin reduction test?
No, that is the wrong answer. The question passes to Jaswant.
Hello.
Hello, yeah, Jaswant.
Hello.
Hello, you are audible. You can answer.
First thing shows some brown color test, ma'am.
Okay.
So, and next is normal blood. Hello.
Do you know the answer, Jaswant?
Is it methemoglobin reduction test for G6PD?
No, that is the wrong answer. Question passes to Gautam.
Gautam is not there.
Anna?
Ma'am, I'm not sure.
USA?
You are unaudible, not audible, USA. Please switch on.
USA,
Ma'am, sorry, can I try and answer?
Ma'am, can I see the first slide once?
Previous slide, please.
You told that Heinz bodies are found from birth, ma'am.
Yeah.
I think it's HB, colon or Genova, etc.
Very good. Excellent. Really excellent. That's a good answer. It's basically a heat denaturation test used for diagnosis of the unstable hemoglobins. And one of these can be HB colon or anything can be possible. So you will be awarded 15 marks for this. That's the end of this round. Now, next slide, please. Coming to the scoreboard, with the end of the third round, we have the lead. I'm not able to see. Yeah. Aras is leading with 75 marks. Next is USI with 60 marks. And next is Aruneshwar with 45 marks. Followed by Jaswanti and followed by Anna. Gautam is yet to open his chat. I would like to introduce Dr. Urmimala to take up the next round. She is a DM resident from PGI Chandigarh, DM resident from the Department of Clinical Hematology. Very enthusiastic and hardworking resident from PJMS. Now I would introduce Urmimala to take over the next.
So good evening, everyone. Can you hear me?
Yes, ma'am.
Yeah, so hope you are enjoying the quiz. So I'm Dr. Urmimala Bhattacharjee. I'm from PGI Chandigarh, and I will proceed with the Gemini round. So next slide, please. So coming to the Gemini round. So all you know that Gemini, they are twins. So all of you will be given a clinical situation and you will be asked two questions, question 1 and question 2. So each question carries 15 marks And for each question, you need to give your judgment, your decision, and you need to explain why you are saying, giving that answer. So if you answer the first part correctly, then only you will be asked the second question and you will be given marks. So in case you can't answer the first question, that is question 1, but you answer the question 2 correctly, there will be no marks. So you have to answer question 1 to attain the question 2 for each question. So each question will be on a clinical scenario and you need to decide upon the treatment and you need to justify why you are giving the treatment. So there will be no passing in this round and there are no negative markings, and this round will go from candidate F, that is participant F, to participant A. So Aruneshwar, followed by Paras, followed by Yuvavasai, followed by Anna, followed by Gautam, followed by Jaswanti. So am I clear? Any doubts from anyone? So we can begin with a dummy question. So next slide, please. So in this question, you see the PB, peripheral blood film, is of a 20-year-old woman whose peripheral blood film is shown, frequently visits the emergency department with episodes of generalized body ache, which get relieved with hydration and PRBC transfusion. So Aruneshwar, so this is a dummy question. So question 1 to you. Next slide. These are the laboratory data which has been provided for this patient. Go through it properly. Coming to question 1. Next slide, please. What drug will you start for this patient? Aruneshwar?
Yes, ma'am.
Answer, please. You have to answer within 15 seconds. It has been discussed.
Can you go back to the slide?
Previous slide.
Yes, ma'am.
It's on today's discussion only. Very easy. Okay. So next.
Hydroxyurea.
Yes. Next slide. Next slide, please. So your answer is correct. So far, you will face the second question. So a few months later, the above patient presents to the emergency department with dyspnea, tiredness and fatigability following an episode of fever and sore throat. So the laboratory investigations are given. So go through it properly. So we have to identify the commonest infection that can lead to this clinical manifestation. Answer within 15 seconds. So your answer, please. Only 2 seconds remaining.
Streptococcus pneumoniae.
No. So this is a typical aplastic crisis caused by parvovirus B19. So since you answered the question 1 correctly, you will get 15 marks. So this is a dummy situation. So let's begin with the round. Aruneshwar again. Yes. Next slide, please.
Yes, the screen is not visible. Can you just wait for a second? Yeah, yes, ma'am.
Okay.
Yeah, you can go. Yes, I'm ready. I'm ready. I'm ready, ma'am.
Okay, you're ready?
Yes, ma'am.
So let's start. So Aruneshwar, your question. 16-year-old previously healthy woman presented with new onset fatigue. Physical examination was remarkable only for mild pallor and a just palpable splenomegaly. Next slide, you will see the laboratory investigations of this patient. Next slide, please. So go through the investigations properly. Aruneshwar, again, you have become invisible.
Ma'am, once again,
okay.
Nothing is seen on my screen. For a second, 1 second, ma'am. Hello, ma'am.
Yeah, I'm audible. You are audible.
Actually, nothing is visible for my. Yes, ma'am. Yes.
Go through the investigations.
Polychromasia, IgG weakly positive, anti-C3.
So should I go to the question?
No, ma'am.
I haven't started the question yet. So,
Okay. Yes, ma'am.
so question please, next slide. So what is a drug of choice to start with?
Ma'am, is it rituximab?
No. So why are you calling it rituximab?
Actually, steroids, it could be a hemolytic anemia. I could start with steroids since it is IgG positive, 2 positive with anti-C3 also.
So it is basically both positive. Okay, so it is.
Then I have to go for steroid should be the first line. I have to confirmation first to confirm it is a warm antibody hemolytic anemia by a monovalent IgG.
So it's basically both are positives, both IgG and C3D are positive.
Then I'll go for steroids, prednisolone 1 mg per kg.
So, but you have answered rituximab. So first answer will be taken correctly. Sorry. Answer is steroid. So do you want to go try the second question even though you are not getting the marks? So let's show him the second slide. Okay, go through it. The patient presented after the starting of therapy to the emergency department 4 weeks later with altered sensorium. So these are the vitals. These are the laboratory evaluation of the patient. So what it is and what immediate next step of management will you start with this patient? So please try. One correct answer. Yes. So you want to answer? Anyone?
No.
Anyone else who would like to try? One endocrinologist was here. Who was that? I think Gautam.
Ma'am, stop steroids and give antibiotics.
And insulin.
So basically it is hyperosmolar, hyperglycemic, non-ketotic coma. The patient has presented with dehydration, BP 90/60. Immediate first step is hydration, IV fluid NS, normal saline, followed by insulin. Okay. So no marks for Aruneshwar. Next question. I'll move on with Paras. Okay, Paras, team E. So
yes, ma'am.
Paras, can you see the question?
Yes, ma'am.
So you see a 22-year-old woman is brought to the emergency department after having one witnessed tonic-clonic seizure. She had appeared confused for the preceding few hours. On examination, she is febrile, appears slightly confused, and otherwise, other neurological and physical examinations are normal. The laboratory investigations are given. Go through it.
Yes, ma'am.
So next slide. This is the PBF.
Yes, ma'am.
Question to you. Question 1. Next slide. So what is the next step of management for this patient? And your diagnosis.
Plasma.
Yes.
Plasmapheresis.
Very good.
And diagnosis TTP, thrombocytopenic purpura.
Excellent.
Thrombotic thrombocytopenic purpura.
Excellent, Paras. So you will face the second question. So question 2 to you. So during the second session of plasmapheresis, the patient developed lip tingling and twinges in the lower extremities. Name the electrolyte imbalance that should be immediately checked for this patient.
Respiratory alkalosis.
Sorry, that is electrolyte imbalance. 7 seconds left.
Hypocalcemia.
Very good. But okay, I'll give you marks. So 15 plus 15, 30 marks to Paras. Very well done.
But you had said that the second answer would not be considered for me.
Okay. So, okay, let's take to that.
Sorry for the interruption, but...
I didn't know. I thought that it may be acid-base disorder.
So basically, okay. So
Means respiratory alkalosis can also cause hypocalcemia. So
okay, so I'll give 15 marks to you then. So it will be unjustifiable for Aruneshwar. So Paras will get 15 marks only. So next I'll move on with Yovasai. Yovasai, can you see the question?
Yes, ma'am.
So your question is on a 26-year-old man who presented to the emergency department with history of high-grade fever with chills rigor. His peripheral blood film is shown. He was started on some medication and he was discharged. So returned after 5 days with fatigue, shortness of breath on exertion and passage of cola-colored urine. Hemoglobin is 6, total bilirubin 5.6, direct 1.1. Next slide. Name the inciting drug.
It is Primaquine, ma'am.
Very well done. So why are you calling it prime? Why are you saying this? Justify yourself.
First, the diagnosis is malaria, ma'am, and the patient was given Primaquine. It could be G6PD deficiency, which was exaggerated, ma'am.
Very well done. Can you specify the type of malaria?
Visipoid.
Means which one? Vivax, falciparum? No,
Vivax.
I just asked, yes. Okay, those they are the PBF was showing trophozoite of Vivax. Very good.
Yes.
Proceeding with the second question. Next question to you. So if he marries a female with normal genotype, so far this condition is concerned, what percentage of his sons will be the sufferers? So we have to tell the percentage of his sons that will inherit this disorder and will be the sufferers. So
I think none of them.
yes, so percentage?
0.
Very well done. So 30 marks for Yuvasai. Very good. Okay. Then Anna Matthew. So can you see the question?
Yes, ma'am.
So this is, you have to think beyond hemolytic, means you have to think in your interested field, general medicine. So a 53-year-old farmer working in the paddy fields of Orissa presented to the local hospital with severe pain and swelling of his left foot. On arrival, the patient was pale and complained of dizziness, nausea, and vomiting. So the vitals are mentioned: BP 96/55, 120 pulse rate, temperature 36, SpO2 93% room air. Next slide, please. Next slide. Okay. So go through the laboratory investigation and the peripheral blood film. So think beyond hemolytic. All the clues are there in the picture on the first slide.
Yes, ma'am.
Next question. Next slide, please. Name the life-saving drug that should be immediately given to this patient.
Ma'am, in view of the fact that he had a snake bite, looking at the fang marks, and it was a hemotoxic snake. So ASV should be keeping in mind that the big four in India, as well as hydration, because hemolysis.
Yes, very good, very good. So question 2 to Anna. So identify this base site test. I want the entire full form that should be regularly performed in the above clinical situation. I want the entire full form since you have answered the question.
Ma'am, the test is WBCT, whole blood clotting time.
Entire answer, you should be precise.
Sorry, I didn't get.
So that is not the complete answer. You should be precise.
Whole blood clotting tilt test.
No, time is out. So anyone else, the entire answer for this test?
Is it 20-minute whole blood clotting test?
Very good, Aruneshwar. So it is 20-minute whole blood clotting time test. So 15 marks for Anna. So team B, Gautam. So Gautam, you have a 16-year-old male. Can you see the question, Gautam?
Gautam is not there basically. He has dropped out.
So since Gautam is not there, we'll continue with the 5 participants now. All the rounds will be then. So what you can do is.
So I can answer this question.
No. So what happens is then the number might change. No, the B, C, then there will be confusion. B will go to C and the C question will go to D, etc. So you skip the B and go to C directly.
So, next slide.
Somnath, can you just go to C question? That's best.
Okay. So Jaswanti, is she here? So it is a question for you. Jaswanti,
yeah,
are you here?
She's here.
Okay,
just a minute. My screen is not loading. It's not loaded yet.
Okay.
So can you see now?
Jaswanti, can you see the screen?
Yes, sir.
Okay, great. Go ahead.
So so look at the, there is a picture on your screen. So observe it properly. So next slide. So question 1 to you. Identify the injection that is being given to a 22-year-old transfusion-dependent thalassemia patient with severe degree of cardiac iron overload. Your time starts now. So 15 seconds over.
Is it chelation?
What?
Hello?
Yes.
Is it chelation therapy?
So you have to name the drug. You have to be precise.
No, ma'am, I don't know.
So it was already discussed in the first round. This is desferoxamine. So, okay. So next question, although you will not get any marks. So along with the above injection, the patient was started on an oral medicine, which caused severe knee and ankle joint pain. Can you name the drug? So you can just try, there is no marks. So anyone else want to answer? Anyone among Anna, Yuvasai, Paras, Aruneshwar? You can try. So let's not waste time now. So is diferiprone another chelating agent, oral chelating agent, which is notorious to cause joint pains. So this round, very well performance from all of you. So at the end of this round, Yuvasai and Paras both are leading with 90 marks each, followed by Aruneshwar at 45, Anna at 30, and Jaswanti at 25. Congratulations to all of you. All the best for the following rounds. And so I'll hand over to Dr. Ketan. So Dr. Ketan is doing DM Hematology in CMC Ludhiana, and he is a very competent doctor and a quiz master also. So I'll hand over to Dr. Ketan. All the best to all of you.
Hello everyone. Hi. Yuvasai, Paras, you are doing very well. Continue with the spirit. Aruneshwar, Anna, Jaswantini, lots of points to be scored in next 2 rounds. Buck up. Okay. Next slide, please. So this round is, next slide, please. Yeah. This is the casino style progress round, right? And the questions will start from participant F and we will go to participant A. There will be no passing. So you can score a lot of points. The points will get doubled if you answer correctly, or it will get halved if you answer it in a wrong style. So level 1 question, 15 points, level 2 is 30 and level 3 is 60 points. No minus marks for level 1 question. However, if level 2 or 3 is unanswered, the previous score of this round will be halved. I have a demo question to explain it to you. Next slide. Yeah, so the demo question is 20 years gentleman with bleeding gums. He has this pancytopenia, low retic count and bone marrow. Cellularity is 10%. What is the diagnosis? Anybody? This is not related to hemolytic anemia.
Aplastic anemia.
Aplastic anemia. This is level 1 question. You progress to level 2. Next slide, please. What is full form of ATG? So if you answer here incorrectly, you will go back to the score of half of first round score, that is 7.5. Okay. And if you proceed to round 3, so that means you will be playing for the question which carries 60 marks. And if you don't answer it correctly, you will be getting half of 30. That is 50 marks. You got the rules?
Yes,
Yes, sir.
Okay. Let's begin gambling.
One sec. Ketan,
Yes, sir. Yes, sir.
In the second round, first round, they have got 15.
Yes, sir.
So, yeah. So, level 3, the 30 will becomes 15. That's right.
15.
You're right.
Yeah.
Okay.
Okay, sir. Okay, so question to contestant F. Can you move the slide, please? Next. Yeah. So level 1 question to contestant F. Next slide, please.
Yes, sir.
Yeah. So look at the picture. This is a complement pathway, and you can see the diagram.
Yes,
Oh, yeah. You want to say anything?
so no, sir.
What disease are you considering by looking at these 2 cartoons or 2 pictures?
Sir,
I'll
think at paroxysmal nocturnal hemoglobinuria.
Perfect. You are right. So 15 marks to you. You would like to go for level 2 question?
Sir, excuse me, sir. After seeing the question, if I don't answer, what would be the...
So if you don't answer, you will get 7.5 marks. If you don't answer level 2 question.
No. See, his question
Okay,
is,
if I answer, if you don't answer, if you are answered wrongly, it is going to half.
Even if you don't answer, you answer wrongly, your score of level 1 would be half.
Correct.
Would be,
you
And
cannot
it is only for this round. And the scores of halving is only of this round, not for the next round.
That's why you are gambling.
Score.
It's a casino style
Okay,
round.
sir,
You
yes,
are gambling here.
Yes,
You will
sir,
leap
okay,
in front of others if you answer correctly.
Okay, sir.
Level 2 question. You want to take it?
Yes, sir, I'll take it.
Okay. So name the specific drug which is FDA approved that has been indicated in the treatment of classical PNH.
Eculizumab.
Wow, great. You are right. 30 points to you. You want to take level 3 question?
Yes, sir, I'll take it.
You are gambling?
Yes, sir, I'll gamble.
Okay. Level 3 question. Yes, next slide, please. Okay. So these patients who are on eculizumab, they are at high risk of particular infection. So which vaccine must be recommended to them?
Sir, they are at risk of meningococcal infections.
So which vaccine?
Meningococcal B vaccine should be given to them.
Wow, great. Amazing. You have got 60 marks. Very nice, Aruneshwar. Very nice.
Thank you.
Okay, 60 marks to Aruneshwar. We'll move to participant E. That is Paras. Hi, Paras.
Yes, sir.
You're ready?
Yes, sir.
Okay, level
Yes,
1
sir.
question to you. 34-year-old lady presents with easy fatigability and icterus along with splenomegaly. Her lab parameter shows HB of 5.8, retic count of 7%, LDH is high. There is indirect hyperbilirubinemia, BCT is positive, and peripheral smear shows spirocytes.
Yes, sir.
Right? Next, yeah. So this is a case of AIHA. right?
Yes.
Autoimmune hemolytic anemia. So there is an agent which has brought revolution in the treatment of non-Hodgkin's lymphoma. It's being used since 2006 in India. It's a preferred second-line agent for AIHA. Which is that agent?
Rituximab.
Good. Perfect. 15 marks to you. You would like to take level 2 question?
Yes, sir.
Okay, we'll go to level 2. Next slide, please. So rituximab is a monoclonal antibody, as you know.
Yes, sir.
What type of antibody it is? What is the type?
So it is anti-CD20.
Yeah, but what is the type? Means
So chimeric antibody.
perfect. Okay, we'll grant the marks to it. It is IgG kappa type of antibody. It's a chimeric antibody, right? Perfect. So you would like to go for level 3 questions. Please don't move slide till we confirm whether it's going for level 2 or level 3. Okay. Paras, would you like to go for level 3? You have 90 points with you. Like to go for level 3? You'll get 60 points if you answer correctly.
He has already got 30 now.
Yes, sir. He has already got 30.
Like Amitabh Bachchan says, if you quit now, you can get 30 plus 90, that is 120. But if you go to level 3 looking for 60, and if you lose, you will get 15 and you still be 105.
So no, sir, I would not like to go.
Not like to go. Are you sure?
I've discouraged you from going up.
Yes, sir.
Paras, are you sure? I'm again asking you.
Yes, sir. I would not like to attempt.
Look, you can gain 60 marks. Okay. Okay.
No, sir.
Okay. So we'll just see the question. Can you show the question? Name one established infectious complication which occurs with rituximab. You know the answer?
No, sir. I'm not sure, but maybe atypical mycobacterium.
So yeah, you would have lost 15 points. Good decision, Paras. Good decision. Okay. So you would get 30 points, right? The answer is either reactivation of hepatitis B virus infection, or maybe progressive multifocal leukoencephalopathy by prion. Okay, so participant D, USI. We'll start
Yes,
USI.
sir.
Okay, level 1 question.
Yes, sir.
So he is a 34-year-old gentleman who presents with fever, altered sensorium, with HB of 6.2, MCV of 110, and creat of 1.9. You can see the picture.
Yes,
What is
sir.
the diagnosis?
It is microangiopathic hemolytic anemia.
Can you be more specific?
Fever, altered sensorium, and HUS, sir.
TTP, but I'll grant marks
Yes,
for
sir.
microangiopathic hemolytic anemia.
Yes, sir.
You have got 15 marks. You would like to go for level 2 or not?
Yes, I would like to go, sir.
Okay. Level 2 question. Which anti-myeloma drug is often used in relapse refractory cases of this condition? That is TTP.
Lenalidomide, sir.
No. I'm afraid. You have 2 seconds, 1 second, you gone. Okay. So it's bortezomib. Okay.
Okay.
Bortezomib is used for relapse refractory cases of this condition, that is TTP. So we'll see level 3 question. Level 3 question, can we see? He will get 7.5 marks. You can note it down. So do you know who these 3 scientists are?
No, sir, I'm sorry. I don't know, sir.
Who are they in relation to bortezomib?
No, sir.
Anybody else? Anybody else want to guess? Jaswantini, Anna, Aruneshwar.
They got
Paras.
Nobel Prize for chemistry, sir.
Yeah, perfect. In which year and for what? You are absolutely right.
2004 or 2005, something.
Wow, 2004. You are correct. For discovery of ubiquitin proteasome pathway, which is Bortezomib is a proteasome inhibitor, so that way it's related. Good, good. You won't get marks for it, but good answer. We'll go to next participant, Anna. Yeah, participant C. Next question, please. Next question. Next slide. Next slide. Okay.
Anna, unmute yourself. Unmute yourself, Anna, please.
Yes, sir. Yes, sir.
We will start. 62-year lady present with complaints of weight loss, low-grade fever, with CBC showing HB of 5.8, MCV 106, and rating 15%. Look at the TLC. I have highlighted it. TLC was very high, 70,000. Lymphocyte predominant. Platelet was 50,000. Look at the smear. What's this condition?
So based on the elevated TLC and especially lymphocytic predominance, as well as lower red blood cells and platelets, I would say CLL, chronic lymphocytic leukemia.
Nice. Though it's not directly related to our topic today, but yes, it's CLL. You would like to go to level 2 question, Anna?
Yes, sir, I'll try.
Okay, good. So level 2 question, please. So same question. Now the highlighted parameters you should see. HB is 5.8, MCV of 106, and rating is 15%. Please click, sir. Please click. Next slide. It's same slide, but next. Yeah. So which simple lab test you would like to do to look for the probable cause of anemia in this case?
So considering CLL has a high predominance of autoimmune hemolytic anemia, I would look for DAT.
Good, good. Very good. So 30 marks to you, and level 3 question you would like to go for level 3 question, or you want to gamble?
I think I'll stop here. I'm not.
Stop here. Why?
I'm not
Anna,
sure.
You are at 30. Don't you want to take your chance and score another 30 marks?
So I'll try, sir.
You have nothing to lose here, right?
Yeah.
Yes, sir.
Good. So level 3 question?
Yes, sir.
Okay. So level 3 question, please.
So is this Dr. Binet Rai who proposed the staging? The Rai staging of CLL?
Yeah. His name is Dr. Kanti Rai. Yeah. Perfect, Anna. But look, you scored 30 more marks. Nice.
Thank you, sir.
So 60 marks to you, Anna. You have jumped to 90. Great performance.
Thanks, sir.
So Gautam is not here. We'll go to Jaswantini. Participant A. We will skip this question. We'll go to next question, please. Next. Yeah. So participant A, Jaswantini, level 1 question to you. This is a 21-year female with fever and abdominal pain. She has anemia. WBC is 4,800. Platelet is slightly low. MCV is 78. LDH is elevated. DCT is negative. Ultrasound is suggestive of portal vein thrombosis. Next slide.
Sir, just a minute, sir. My screen is loading, sir.
Of times. Can you click on next?
Can you see Jaswantini?
No.
Go back. Jaswantini, can you see the slide?
It's loading, sir.
So you are on a mobile device, huh?
Yes, sir.
Okay.
Can you see it now?
Yes, sir.
So, yeah. So you have gone through the question?
Hello, am I audible?
Yeah, you are audible. Can you guess which condition is this? Though that's not the question, but can you guess which condition is this? Jaswantini. Can you listen to me?
Some ascites is there, sir.
Huh?
Ascites.
No. So it's a case of PNH, right?
Okay, sir.
So which is the diagnostic test which is used for this condition? That's the question.
Ketan, since you have given the answer, I don't think you can grant this question.
No, that's not the answer, sir. answer is which is the diagnostic test for this condition. I had just asked her what is this case.
Flow
The question
cytometry,
is,
sir.
yeah, flow cytometry. So that was the question.
No, but I don't think technically that is wrong, because you have already
Okay, sir.
told the diagnosis.
Okay,
Then
sir.
it is easy to guess, and this question has been repeated many times. So I'm sorry,
Okay, sir.
Jaswantini, we won't be able to grant this.
Okay, sir. Okay, we'll take that.
I think you can
So
give
sorry,
a
Jaswantini.
sorry,
Yeah.
Okay, sir. No issues.
You
B
fine.
question.
You won't be getting any marks.
Pankaj is saying something. Pankaj, can you repeat
Half
that?
marks, sir.
Yeah, I would say
No,
give
no,
a participant B question.
Yeah. No. So leave it. It is, she couldn't even diagnose it. So then we cannot say the diagnosis, and that's separate.
Okay, sir. Fine. So the round ends here. I think Paras Mahajan is leading here with 120 points. Aruneshwar has 105 just behind him. And Jaswantini is 25. USC and Anna, you are close to them. Come on, buck up.
Sir, level 2 and 3, sir.
Huh?
Level 2 and 3.
No, level 1. Yes, sir.
Only if you answer level 1, you have an opportunity to go level 2, right?
Okay, sir. Okay, sir. Thank you, sir.
Sorry, Jaswant. So here I would like to introduce Dr. Joseph, sir, who is the brainchild behind this quiz and who has worked very hard for actually conducting this quiz. So over to you, Joseph, sir, for rapid fire round.
Okay, so nice to have you all here. And it's unfortunate that Gautam has had to drop out. But this is a round which you could probably gain 100 and lose 100. So you have to play it well. If you know it well, you can get up to 100, and otherwise don't guess and say pass. So the speed and wits will be checked here. There are 10 single answer questions. Each person would have a total of 60 seconds to answer the questions. So that 10 questions, 6 seconds per question. You can invite as many questions as possible during the time. So if you play well, 8 to 10 questions you can hit. If you take time to think and plan, if you don't know, say pass. If you say wrong answer, it'll be a negative. And there are a few true or false questions. You would say true or false. And my response would be correct, incorrect, right? You must get this into your brain well, because it is going to be fast. And if you say true, I would say correct. And if it is correct, that's how it comes. If there are, by mistake, my slip of tongue, if there is a problem and my team tells me that, we will do the corrective things in the end, but we will not stop there and do the rectification. Next slide, please.
Sir, I have some small doubt.
Sure, go ahead.
Sir, will all the questions be displayed at a time, or it will be coming one by one, the next after the next?
One by one. We have a simulation round next. So okay. Aruneshwar, since you are the first person who have to go, and everybody else has an opportunity to see what you are going through, we would go through the dummy round with you. Okay?
Okay, sir.
Simulation round. Next slide, please. So we have, this is the spread of the question, so you can be prepared accordingly. First would be an identifying the personality, an Indian living legend. Second question would be a single sentence question with an acronym or an answer in a phrase, maybe 2 words or 1 word. Next would be your answer would be true or false. The next would be who am I question. In a who am I question, the clues will continue. If you get the answer with the first clue, you say the answer. If you think I'm not able to get it, say pass then, so that you don't waste time. So you have to play it well. Next 2 would be MCQs. You would see 4 choices and you need to choose one. I would prefer the answer there, not ABC. Then would be an image related. You will be seen a diagnostic question or a test will be shown, and you would need to say a 1-word answer what you're seeing there. Next okay. Also would be a phrase answer, and the last 2 would be again true or false. Some of them will be as simple as it seems. Some of them would be difficult. You may not be able to locate, but you know it's at the tip of the tongue. Better to say pass. Okay. Aruneshwar, your time starts now. Okay. You're going to start. This is going to be a blitz round. So it is, okay. Can you go back to 61? Ah, yeah, that's right. Okay. Your time starts now.
Yes, sir.
Famous Indian pediatric hematologist from Northern India, mentor of the first edition of Quiz. Identify the National Hematology Quiz is conducted on the Indian Cancer Awareness Day of November 7th. What is the International Cancer Day?
So it is on 4th February.
Correct. Next question, please. Username and password are mandatory for attempting the screening exam. True or false?
True. Next question.
Correct. Without me, you cannot operate the computer. In real world, the cat is after me. Some may call me my generic name. Others add my family name Pat to me. Who am I?
Pass.
Mouse. Next question. The brain of the computer is a CPU, monitor, screen, or a keyboard?
CPU.
Correct. Who is the leading candidate of the US presidential election? Correct. Identify the device. I started, so I stop. Identify the device.
So I'm not sure.
Webcam. So I want you to see the first question because it is fun. Go back, please, and show us the first question, please. Okay. I wouldn't get the cat out of the box, so I will get the answer to come back at the vote of thanks session. Okay. Let's move on.
Sir, 1 second, sir. Sir, please, 1 second.
Yeah.
So since it is taking time, if you read the question, can I just view the question and answer?
Absolutely. The moment you answer, we go to the next question.
Sir, I request you to not read the question, please. I'll just read out the question on my own.
So that may not be possible. You can mute me if you have to, because that is the way the others would. I mean, is it clashing with you? You can read us this thing. You can mute me out.
No, sir. Not for muting you. Since if you read out, it's taking time. Just I can read an answer. You can give me the right or wrong, right, incorrect and incorrect part.
Okay, go ahead. Okay, but I will have to start the question, and that is how we have practice. Otherwise, there is no fun in. Otherwise, he can give you MCQs, right?
Yeah, and this will be.
Sorry, Pankaj.
Yeah, so this will be equal to everybody. So that's
yes.
Okay,
so
sir.
It's an auditory.
Yeah, yes, sir. Okay, sir.
You have to mute yourself in your brain, I guess. Okay, next questions. Okay, so go to the next question. Okay, participant F, Aruneshwar. Next slide. And next slide. Your time starts now.
Yes, sir.
Next. Name the hematologist from India who was awarded the Padma Shri in 2019.
1 second. Pass.
Dr. Mohammed, next slide. What is the acronym for the 1 Willebrand factor cleaving?
Adam TS13.
Correct. Next. The total ion binding capacity is inversely proportional to serum ion levels.
True.
Correct. I exist in 4 forms. My half-life is 21 days. I can traverse any membrane as I am small.
Pass.
Next. In the positive Coombs test, the immunoglobulin present on the surface of the red cell is?
IgM.
Incorrect. Next slide. Which of the following is celebrated on October 13th every year?
Pass.
Next. Identify the test.
Esproff test.
Correct.
Naked eye single tube red cell expression.
Correct. What part of intestine best absorbs iron?
Duodenum.
Correct. Next slide, please. Sorry, your time's up. You could get 8 questions you answered. My team would tell us how many were right and how many were wrong. Okay.
4 right, 1 wrong.
4 right, 1 wrong. Does our team here corroborate with that, Dr. Miss Mridul?
Yes, sir.
Mridul?
Yes, sir.
Okay, so that's 4 right and how many wrong?
1 wrong.
Okay, so you get a total of 30 points. So you have come to 135, current leading person. Okay, so you have close competition from Paras. Paras, are you ready?
Yes, sir. Sir, am I audible?
Yes, very much. Shall we start?
Okay. Yes, sir.
Your time starts now. Name this famous Indian
Pass.
pediatric hematologist. Next slide. Dr. Revati. Excessive proliferation of macrophages in bone marrow.
Hemophagocytic lymphohistiocytosis.
Correct. Next slide. Low platelets and low white cell counts in patients put the patient on high risk of hemolysis.
Pass.
Next. I'm a macrophage present in liver sinusoids, express FC receptors on my surface. I take part in the red cell destruction, which is coated with C3. Who am I?
Kupffer cell.
Correct. As for biomedical waste management rules, what is the color of the bucket you would discard blood-stained gloves?
Red.
Correct. Next slide. The UN organization which became first to accept.
Pass.
Correct. Next slide. Identify the machines used in stem cell transplantation and blood banks.
Pass.
Next. What is the approximate number of genes in human body that codes for functional proteins?
Pass.
30,000. Cyclosporin is a drug which is used rarely for Evans syndrome and SLE can cause hirsutism. True or false? Your time's up.
Yes. Just true.
So it's taken as, no, it is taken as pass because the time's up. Okay. What's the score?
3 right answers.
No wrong. So 30 points to you. You played well. You thought well. You didn't want to take any chances. So we'll come back to those answers later. That was Dr. Revati, and it is important to know the Indian legends. Okay.
Yes, sir.
Okay. Participant D. Who's participant D? USI Kumar. Are you ready?
Yes, sir. Am I audible, sir?
Very much. Shall we start?
Yes, sir. We can start.
Okay. Somnath, please switch on. Your time starts now. Dr. M.B. Agarwal. Next slide. The normal development of neutrophils. What is the stage between metamyelocyte and neutrophil?
Band forms.
Correct. Next slide. Iron deficiency and thalassemia can be protective to osmotic fragility and cause false negative results in a patient with hereditary spherocytosis. True or false?
False.
Incorrect. Next slide. During the process of my maturation, I have given up my capacity to produce RNA, ability to produce protein, and most efficient ATP production mechanism. Now I am relying on the preformed proteins and anaerobic glycolysis. Who am I?
Warburg metabolism.
Incorrect. You have to say, who am I? Red cells. Incorrect.
Parvovirus.
No. Yes, correct. Next slide. Question number 5. Correct. Parvovirus. Next slide. Next slide, please. We'll give you 2 seconds more. Somnath, we need to move on. Next slide, please. I'll give you 2 more questions. Which state in India became...
Pass.
Next slide. So 1 more question to you. Identify the devices used at the bedside while managing hematology patients.
Pass, sir.
I'm sorry. That's all we can give you. So next slide. So how many correct? How many wrong? How many incorrect?
2 correct, 1 incorrect.
So 10 more.
2 correct, 2 correct, 2 incorrect. 2 correct, 2 incorrect. So 0.
So
score is 0.
You are at 0. Okay. Anna, opportunity to make it 190. Right?
Okay.
You have
Yes,
nothing to lose here. You get all your thoughts in place. Play it well. Okay. Next slide. Sorry. This is participant D. You need to move forward and come to that stopwatch picture. Yes. Are you ready, Anna?
Yes, sir.
So your time starts now. Name the Indian
Pass.
bond. Next slide. Transfusing B positive patient with B negative is called minor mismatch transfusion.
True.
Incorrect. Next slide. While treating patients with oral iron, stool color becomes black. Correct. My absence increases the MCV and abundance has no value. The person may forget things and feel pins and
So vitamin B12.
Correct. Next slide. Which of the following HP renders protective effect in sickle cell anemia?
HPF.
Correct. Next slide, please. Which day is observed as
pass.
Next slide. Identify the test.
Osmotic fragility test.
Correct. Next slide. What do you call when a patient presents with autoimmune hemolytic anemia and immune thrombocytopenia?
Pass.
Next slide. Howell Jolly bodies are seen in megaloblastic anemia. True or false?
Okay. So false.
Incorrect. They are seen in megaloblastic anemia. I'm sorry about that. And what's the total score? What's how many correct? How many incorrect?
20. So 4 correct, 2 incorrect.
Okay, so you get 20 more points. That is makes it 120. Okay. Jaswantini.
Yes, sir.
Are you there? Okay.
Yes, sir. Yes, sir.
So you can make it to third position if you play all the 10 corrects. Okay.
Okay, sir.
Shall we start, Jaswantini?
Yes, sir.
Okay. Your time starts now. Name the Indian hematologist who is the first author of WFH Guidelines 2020. Next slide. Name the cell in human body with no nucleus other than red blood cell.
Pass, sir.
Platelets. Next slide. The blood bank workup of a patient presenting with DIC shows decreased PT values.
True.
Incorrect. Next slide. They want me for everything from AIHA, PNH, ITP, TTP, yet they blame me for increasing the sugars and the blood pressures. They say steroids. Next slide. They name the bell-shaped curve where percentage is included in one standard deviation on both sides.
B, sir.
Incorrect. 66%. Next slide. CoviRap is a low-cost portable kit for rapid diagnosis of coronavirus developed by the Indian team of researchers. Which institute does this team belong to?
IIT Kharagpur, sir.
That's correct. Next slide. So that's the end of your round. The time's up. So I will just ask you identify the device used in blood bank, but no scores for you for this.
For freezing device, sir. I'm not sure, sir. Pass, sir. Pass.
This is a platelet shaker. Okay. So that brings us to the end of the quiz competition. Now 9:30 almost, and we crossed almost an hour more than the anticipated time. So can we go to the last session slide, Somnath? We're winding up. Next question. Keep going. Can we go to the last?
Yes.
Okay. So
plus minus 10.
Minus
Sir,
10.
minus 10.
Minus 10.
Ashwin, just one me. 2 wrong answer and 1 correct answer.
So there is a corroboration from here, and that corrects with it. So we have a clear winner here with Paras Mahajan, and all claps to you, Paras. And we have Arunishwar as second prize. We would want your confirmation letters from your principal saying that you are a bona fide student joined in particular year, and please send it to us, and your bank account number and PAN card if you already have one, and we will transfer the money into that account. Okay, or we'll send the check across to your bank.
Yes, sir.
Okay. Yes, sir. So 3 cheers to Paras and Arunishwar. Paras, once again, which college are you from? You're from Delhi, I remember.
Yes, sir. Vardhaman Mahavir Medical College.
Wonderful. Arunishwar, where are you from?
Sir, I'm from Tanjavur Medical College.
Tanjavur Medical College. So that's good. Some from Central India and from Southern India.
So actually, our colleges are closed, and I am at my home in Punjab.
Punjab.
So,
okay.
So how to get that letter from the principal?
You have to just send an email to your principal's office and ask him. Everything is nothing can be stopped in this era now that we are connected all over the world on a click of a button. So that's why mouse is a very important part of our lives. That's why I put the dummy question there. Okay, and yes. Interestingly, this is done by mice ideas, and we have a mouse as the question. Okay, so that's enough of that. And next slide, please. And I wanted Arunishwar to see this slide.
Sorry, sir.
I had a dummy question, and we've had our mentors all over, plastered all over the quiz. So I must give you some minus marks here for not
Sir, actually, I knew madam, but at that point, I couldn't, in the rapid fire thing, I couldn't get the name.
Okay, so some of the questions were already discussed earlier. So Before we wind up and come to some future plans, I would request Dr. Pankaj and Dr. Amita Trihan to say a few words for these young, budding, fantastic guys. You guys scored more than many of the DM candidates who would have probably scored. And we had a perfect 50 and a 49. That's fantastic from some of you. Over to Dr. Pankaj and followed by Dr. Amita.
Yeah, thank you. Thank you. It was very interesting, and of the quiz, and it was so interesting. Many of the questions even actually I did not know, so I also learned a lot from the quiz. So when you are attempting the questions, and if you don't know some questions, so you can say, okay, even the mentors did not know some of those questions, so that's okay. And I really thanks Joseph and his team, and all the DM residents who have put so much of effort to make it so interesting quiz. And I'm sure I'm looking actually forward for version 2, which would obviously be more kind of a well organized, in the sense that we had more than 3,000 students registered, but only 890 people could log in. So maybe we need more logins account, and probably a little more organized. There were some questions which I find which were a little difficult maybe for the MBBS level, but we will take the feedback from all of you, as well as from spectators who are looking at the quiz. So with these some points, I thank you very much. I really hope that we trying to make hemotainment, that means entertaining hematology as an entertaining field. So I hope that we have succeeded in making hemotainment, and maybe we will come with version 2 and version 3 and so on. Thank you very much, and have a good day.
Dr. Amita?
Yeah, I think I hope all the students have had as delightful a time as we had. It was really enjoyable watching all of you, and it's I think 3 cheers to all of you for doing so well. And it's delightful to see that we have such brilliant minds again amongst us, and all of you are the future of the country. Not only, I mean, really the future of the country. And to me, I think it was the greatest delight to have so many of you participating. Though Pankaj has already said, it's unfortunate that because of the technical glitches, everybody could not participate, which of course we'll rectify as time comes. But it's, a real delight to be among such brilliant young minds who are doing so well at such a young stage of your career. And at a slightly personal, selfish front, we hope some of you become hematologists. But whatever you do, we wish you all the best and wish you many, many more such, not only quizzes, that, such good events come by us. I think the pandemic has taken its toll on all of us, but it has also taught us that there's so much you can do despite not being able to move out and go to other cities. The internet, now I think now we really realize how useful and what an amazing thing internet is, since we've been able to do so much with it. So congratulations to all the winners. Congratulations to every student who took part, and all the best for the future. Thank you. And of course, the most important thing is to congratulate and 3 cheers for the people who have put in quite a few hours of hard work to organize this and make it such a good, happy, successful day. Joseph and his team of all these young quiz masters have done an amazing job. And, I think maybe you should retain this team so that we can have more quizzes in the times to come. Thanks a lot.
Thank you, ma'am. I would like to call upon and show all the team members and the back end stage, and some pictures we will put up on the YouTube later. So just to show you a few main 3 or 4 people who are teams who have worked behind this. One is the Quiz Squad, the virtual platform team at Gujarat, and our Quiz Intelligence team. And I'll show them to you in our backend team from CMC Ludhiana, who have been quite remarkable in supporting this event. Next slide, please. So last 2-3 slides, bear with me, and we will wind up in just 2 minutes. Next slide, please. So that's our team who came over from PGI. Next, before this. Go back, Somnath. You pass pointed this. Okay, go back, please. Yeah. So that's a PGI team who. Next slide. That's a PGI team who came over to CMC Ludhiana today, and that's one picture we took just before the quiz started. Next slide. So that's the Mice Ideas team who worked behind, and many of them have communicated with us many occasions in, curating many of these things. Next slide. So that's the 2 young brains behind the Quiz Intelligence team. There are many more people at the back. I don't know why the photograph has not come. So that's Mrudul and Shweta. And next slide, please. Okay, so I think the other team members' pictures we will show next time. So the future plans with the experience game, we understand that the IT was not up to the mark, and we need to get the connections going. We need to improve the experience. Infotainment becomes a hemotainment, and we will have more interactions. We think about doing thrombosis quiz next time, and that's for suspense to tell you which is the date and the time. We will discuss among ourselves and come back with the time. And there are so many people who are disappointed who could not log in time. And I'm getting so many messages here in my mobile. I wish we could, that's what is actually keeping us going in whether to continue or not. Thank you so much, and have a great evening, and have a nice dinner. Good night, and thank you.